Hi, so you're here today to get an ear cleaning, is that correct? Okay, so have you had any problems with your ears since you're getting the cleaning? Okay, so a lot of wax buildup, got it. Okay, yeah, we can definitely do that for you. I'm just gonna start by putting on my gloves, making sure that you and I are both healthy. Have you had this for a long time? Okay, so it's been like clogged up for a week. Okay. All right, that's totally fine. Things like this happen all the time. Has it affected your hearing at all? It has, okay. So we will do kind of a hearing test just to see what's going on there and work from there. I am gonna get your temperature as well, just to make sure that you're not sick or anything. Okay, just put on this glove. Okay, so we're just gonna start off by getting your temperature. I'm gonna put this on your forehead and just gonna look and see. So stay still for me, okay? Let's see. Okay, a good temperature. Not worried there. And I am going to just touch your ear and make sure everything's looking good, that you're not feeling any pain or any discomfort, okay? Okay. So, add this light. I'm just gonna look and touch, okay? Are you feeling any pain when I do that? Okay, good. Let me continue. Okay, let me look at this other ear now. Same thing, just let me know if you feel any discomfort. Okay, like I said before, are you feeling any pain or discomfort? Okay, good. I'm going to continue now. Okay, so it's looking like both sides don't have any pain, which is really, really good. I'm not seeing any redness on the outer of your ear, nothing swollen, nothing that I'm worried about at all, no lumps or bumps, so everything's looking good on the outer of your ear. So like you said before, that you're feeling a bit like a hearing loss, so we're gonna just test that really quickly before we look inside your ear. So I have this little tool here that makes a click sound like that. So I want you to tell me on what side you hear that sound. So I need you to close your eyes for me. Okay, so now just let me know left or right. Okay, good. You did great there. And now I have this tuning fork, so keep your eyes closed and I want you to tell me if you hear this sound on either the left or the right ear, okay? Okay. Now what ear was that? Very good. And what ear was that? Good. what year was that? And what year was that? Very, very good. Okay, so now what I'm going to do is look in your ears with an otoscope. So this is just going to look in your ear canal, see what's going on, if it is really wax or something else going on inside your ear. So we are going to start with this ear right there. And all you gotta do is stay still, okay? If you feel discomfort, let me know. We can stop right away, okay? All right, so just stay still. We're gonna look right here. Okay, yeah, I definitely am seeing what's going on in there, and definitely seeing a bunch of compacted earwax, which is basically when you use a Q-tip and you basically push that wax super back there, and now it's really hard to get out. So that's kind of what I'm seeing there. So I'm gonna look in your other ear and see if that's the same case, okay? All right, so looking at this ear, so stay still for me. So looking at both ears, I am seeing compacted wax. So what we can do is get rid of that wax and do an ear cleaning for you. That's definitely the reason why you're feeling like you have hearing loss, but it's just your ear canal being clogged by the wax, which happens all the time. So we can continue with the ear cleaning, and hopefully that can help with that hearing loss, okay? I have this syringe here that's going to put a liquid in your ear that's going to get rid of all of that buildup, and then we are going to use a scraping tool to get rid of the rest, okay? It's gonna be painless, so no worries there, okay? Okay, so I'm just gonna begin. We're gonna start with this ear again. So just stay still for me, and if you need to stop at any time, let me know, okay? All right, so I'm just going to start. Okay, good. So we put the liquid. Let me just put the liquid in there as well. So we just put that liquid in there, and I'm gonna take these brushes and I'm just going to massage the ear just to get that liquid going, okay? So just stay still for me. It's gonna go like just in the entrance of the ear, so it's not gonna go any further than that, okay? Okay, just stay still for me, okay? Very good. We're all done with that. So now I'm going to take that tool now and scrape your ear. So I have two different ones. So I'm just going to be using both here. So just stay still like I said. If you feel any discomfort or pain, let me know, okay? Alright, we're going to start with this ear. We're going to begin cleaning. Okay, very good. Now we're going to do the other ear. We were able to take a majority of the wax out of that one. So let me start off on this one, okay? Okay. Same deal here. We were able to get rid of all of that, almost all of that wax. So I'm just going to repeat the process with the syringe and those two fans, okay? So just to make sure that everything else was removed. All right, so I'm just going to put that in your ear. Okay. Good. Now we're going to put it in the other ear. Perfect. And let me get these two fans. Okay. Now stay still for me. Perfect. So we're just going to check with the otoscope again, see what's been going on there, and see if everything actually was removed and that there's no redness or swelling, okay? Starting with this ear. Good, everything looks great. Let me look at the other ear. Looks really, really good on both ears. There is going to be some wax, but wax is important for your ear to protect your ear. So we couldn't get rid of every single bit, but we got rid of the majority that was blocking the ear canal. So now what we're going to do is just double check to see if your hearing has returned. So we are going to be doing those same hearing tests. So all I need you to do is close your eyes for this portion. Okay, good. So we're going to do a test that we didn't do before. This one's with that sound. So I want you to count how many times you hear this sound, okay? Okay, great. Now keep your eyes closed and we will begin right now. All right, how many times did you hear that? Good, that was 8 times. Now I want you to tell me what side you hear that sound, okay? So either left or right. Let's begin. That was both. All right, very good. You passed that test. Now we are moving on with sounds. We have the click sound again. That sounds like that. So I want you to tell me how many times you hear the click sound, okay? How many times was that? Good, that was 10 times. Now tell me what side you hear the clicking, okay? Perfect. You did fantastic. Now we have our tuning fork. And you are going to tell me when you hear the sound stop. Okay? All right, keep your eyes closed. Let's begin. Good. 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 Okay, now tell me on what ear you're hearing the sound. What ear was that? And what ear was that? Okay, very good. You can open your eyes now. All right. So after the test, I can see that now your hearing has returned because we removed all that wax. So nothing to be worried about. It's just wax buildup, happens to everyone. But yeah, we are going to be sending you home with some eardrops that are going to help just in case you do get some irritation since we removed that earwax, okay? And you could just put that on for 3 days. And if your hearing loss returns or you feel any discomfort, please come back. We can do another ear exam on you, make sure everything's looking okay. All right. It was very, very lovely to meet you, and I hope you have a lovely rest of your evening. All right, I'll see you around. Bye. Hi, today we're going to be doing an ear exam and a hearing test on you today. Before we start, do you have any issues or concerns you would like to tell me? Okay. How about hearing? Anything going on with your hearing? Okay, so this is just a checkup. Got it. Well, we're just gonna start off by checking your temperature and making sure that you are healthy. So I'm just gonna put it in your ear here, and it's gonna go in your ear canal. So be very still for me. Okay, just gonna make sure that your temperature is looking good. So we're just gonna put it in your ear. Okay. Let's see here. Okay, good. All right, we're gonna check this other ear. Okay, just put it in there. Good. Okay. Yeah, your temperature looks good. You don't look like you have a cold or the flu, so not worried there. And I'm gonna take my otoscope and I'm gonna look inside your ears. Kind of the same deal. It's gonna go inside just like that other tool. Okay, we're just gonna go inside here. Okay. Good. Very good. Not really seeing anything concerning there, so we're gonna look at this ear now. Okay, just gonna go in your ear. Okay. All right, yeah, I'm not seeing anything there, so everything looks super clean, super clear. Not worried at all. I'm just gonna quickly get your ear measurements for your files. So just stay still for me. Good. And now one more. We have this measuring tape. Very good. Okay, just wanted to double check there. So we are going to start with the hearing test, and we're going to do a simple one. So I need you to close your eyes, and I'm going to make the sound with my hands, and when you hear that sound, I want you to tell me what side you hear it on, okay? Good. So close your eyes and tell me either left or right. Okay, now we're going to begin. Very good. Now you're going to tell me how many times you hear that sound, okay? All right, so that was 10 times. Now you can open your eyes, and I have a tuning fork here. I want you to tell me if you can hear the sound. Okay, can you hear that sound? Okay, can you tell me when you hear the sound stop? Good. Okay, again, let's see this ear. Okay, can you hear the sound? Okay, now tell me when you hear the sound stop. Good. Okay, I need you to close your eyes again, and I want you to tell me on what side you hear the sound. Okay. So what side was that? Okay, good. What side was that? Good. What side was that? And what side was that? Fantastic. You did amazing. Okay. Now we're gonna do a different test. So I have these headphones that are gonna go in your ears or on your ears, and you're gonna hear a beep test. I'm gonna do 2 different beep tests, okay? So I'm just gonna place them on your ears. Let me know if you have any trouble with them, if you can't hear anything, or if they're not a good fit, okay? All right, putting them on. Can you hear me on this side? And can you hear me on this side? Okay. Does it sound muffled? I'm going to do a test here. So this is more of a muffled test. This isn't the test that's on the computer. So I'm going to put an object next to your ear, and it's going to make a sound. Let me know if you hear that sound, okay? Alright. Did you hear that sound? Okay, so then raise your hand when you hear that sound, okay? very quiet at the end. Okay, now we're gonna do a different one. Let me know when you hear the sound. Did you hear that? Okay, what sound was that? Good. Okay, now raise your hand when you hear the sound. You did fantastic. Okay, so now we are going to be doing a different test here. So I have my notes. So this is the computer hearing test. Just writing some information quickly. Okay, so for this one, there's going to be different instructions. I'll tell you what you have to do at that moment, okay? I don't remember what it is right now, but we're gonna begin now. So the first one is a beep test, so tell me when you hear the beep. So you could just raise your hand. Okay. Okay, so for this next one, you're going to tell me what ear you hear the sound, okay? Great, so just let it calibrate. Okay, so what ear? About it for the hearing test. So we can remove this headset off you. So you did very, very good. Let me write down the score. Okay, so it's looking like you passed that hearing test. I wasn't really worried because you did really good last year and I wasn't seeing anything clogged in your ears when I checked with the otoscope. So now I'm just going to test your sensitivity with your ears. So I'm gonna put a couple things in your ear and we're gonna see how you react to it, okay? I have this tool here and this is gonna go in your ear and it's gonna give a little click, so it's blowing air in your ear, okay? Okay, so we're gonna start off with this ear. Let me know if you feel uncomfortable or any pain. Shouldn't hurt at all, but if it does, please let me know. Okay, right here. Okay, so stay still. Do you feel the air? Okay. Good. Okay, let's try the same thing on this side. Okay. That irritate you at all? Do you feel uncomfortable? Great. Okay. We're gonna do the same thing, but with this. Okay, so this is gonna blow air inside as well. Just stay still. Okay, did you feel that? Okay, let's do the other ears. This one here. Okay. Do you feel that? Okay, very, very good. So we're done with this tool. And now I'm just going to look inside your ears with the otoscope again to see if any irritation happened. Okay, so I'm just gonna look at this ear here. Good. So I'm not seeing any redness, but I am seeing some earwax that looks a little stuck in there that I missed before. So it's like kind of compacted. So we definitely need to get rid of that. I'm just gonna look at your other ear. Okay. Okay, so for this one, kind of the same deal. I did miss some wax, but it's not as much as the other one. But don't worry, we're gonna get rid of that today. So let me take my tool. So I have this here, and it's just like a little circle at the end. So it's just going to scrape the wax out. So it's not a tweezer, it's not gonna pinch you or anything. We're just gonna gently remove that earwax, okay? Okay, so we're gonna start off with this ear here, the one we started off before. All right, just stay very still. If you feel uncomfortable or any pain, let me know and we'll stop right away. Now I'm just gonna go in. That one's pretty good. Let me just use this fan here and take out any wax that we missed that might be on the external of the ear. Okay, so I'm just going to brush. Good. Now we're going to do the other ear. And I'm just going to, like I said, just scrape out the wax, and if you feel any pain, let me know. Okay, now let's begin. Very good. We were able to take it out. Now we're gonna get the fan and just blow it away. Just that external. Okay. Very good. I'm gonna check one more time with the otoscope, just making sure that we didn't irritate anything, that we got everything, okay? Alright, so I'm just gonna look at this ear. Good. Everything looks very clean. No irritation, no redness. So your ear looks fantastic. Let's look at this one. Okay, very good. That one looks really good too. Nothing to worry about, no redness, no irritation. So yeah, everything looks really good. Your hearing test went really well. All of them you passed with flying colors, and examining your ears and the measurements, everything is looking perfect and healthy. So yeah, our exam is done for today. Thank you so much for letting me examine you. I really appreciate it. But yeah, I hope you have a lovely rest of your evening, and I will see you again soon. All right, bye. Hi, welcome in. So you're here for your annual doctor exam, right? Okay. So we are just gonna get started right away. I have 2 temperature guns. One just goes on your forehead, and then one goes in your ear. We are gonna start with the one that goes on your forehead. Stay still for me so I can just get this temperature. Okay. Now we we are going to be doing the other temperature gun. That way we are super accurate. So this is going to go in both of your ears. So just stay still for me while I put this in your ear. Okay. Making sure it's a good fit there. Alright, now let's do the other ear. So this one here, just gonna put it in there. Make sure it's a good fit for you. Okay. Alright, your temperature is looking good. Doesn't look like you have a fever. I am just gonna put my gloves on. And I was curious if you've been sick recently in the past 2 weeks. Okay. Anything throughout the year that was concerning or any changes? First glove on. Now let me put my second one. Great. Okay, so I'm just gonna start with my light. Okay, so now I want you to follow my light with just your eyes. Do not follow with your head, just your eyes. Okay. You're doing great. Good. Okay, now I want you to look at my nose. All right, look at my nose and tell me when you see the light, okay? Good. Very good. Keep looking at my nose. Now we're going to do kind of the same thing, but I want you to look at my nose still and tell me when the light leaves your vision. You're doing great. Great. Okay. I'm gonna get the light kind of close and I want you to look up for me. Look up for me. Okay. Now look to the left. Now the right. And now look down. Very good. Okay, other eye. Look down for me. Look down. Look down. Now look up. Now look to the left and to the right. Awesome. Great. I'm going to look inside your ears with this otoscope here. Okay. Stay still. Now I'm going to look at your other ear, okay? Stay still. Okay. Very good. I'm not seeing any redness or anything like that. So now I'm going to listen to your heart and your lungs. So I'm going to put this on. Okay. All right, so just gonna put this on your chest. Okay. All right, so just breathe normally for me, okay? Just breathe normally. Very good, very good. Yeah, just breathe normally. Okay, now take a deep breath. Okay. Good. Okay, take another deep breath. Good. And take one more deep breath. Good, good, good. Great. Okay, now I'm just gonna get behind you. Okay, good. Now just breathe normally. Just breathe normally, okay? Good. You're doing great. Okay. Just breathe normally. Just breathe normally. Alright, now I need you to take a deep breath for me. Okay, ready? Good. Alright, another deep breath for me. Very good. One last deep breath. Very, very good. Okay. Your heart sounds really good. I'm not hearing wheezing in your lungs, so everything sounds normal. So now I'm gonna get your blood pressure. So I'll just choose an arm and I'll wrap it around. Okay. Arm. Alright, awesome. Alright, just stay still for me and keep your arm flat. Okay, so now looking at it, your blood pressure looks good. Nothing to be concerned about, so that's great. Now, I'm just going to look inside your mouth, so open wide for me. So I have this light here. Open wide. Good. Very good. Okay. Get a little light here. Okay. Now, can you cough for me? Good. Good. Everything looks good there. I don't see redness. I don't see any tonsil stones, so everything's looking great there. Let me look deeper in your eyes. Okay. Alright, look over here. Okay. I'm gonna get pretty close. Try not to blink. Very good. Okay, you can blink. Blink, 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 blink. Okay. Good. Let me look at your other eye. this on your eyes. So just gonna block out your vision, but right here has some little dots shine through, okay? So tell me when you see those dots shine through like this. Do you see that? Perfect. Okay, let me know when you see that. Good. 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 All right, now tell me when they go away. Good. 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 Now let's do your other eye. All right, same deal. Let me know when you see them. Good. Now let me see, or tell me when you no longer see them. Good. 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 Very good. Now we're going to bring back my other light. Right, so I want you to look at the light, not at my hand, okay? Alright, tell me what number I'm showing you with my hand, okay? Ready? But you have to look at the light. Good. Good. Okay, same deal, but the light's on the other side. Okay, just look at the light and not at my hand. Ready? Very, very good. So I want you to look at my light. Now my nose, now my finger. Okay, now don't move your head when we do this, okay? We're gonna go pretty fast. All right, look at my finger. Now my nose, now the light. Okay, look at my finger, my nose, the light. Look at my finger, the light, my nose. Look at my finger, the light, and my nose. Look at my finger, now the light. Now look at my nose, my finger, the light, and my nose. Very good. Okay, now I want you to just look at the light. Look at the light. Don't move your head. Good. Again, just look at the light. Look at the light. Good. Okay, look at my finger. Good. Look at my finger. Very good. Now, I want you to look at this. Look at the very tip, okay? Look at the very tip. Right? Don't move your head. Just look at the tip. Sorry. Just look at the tip. Very good. Just look at the tip. Look at the tip. Very good. You're doing fantastic. Great. Okay. Oops. Wrong way, sorry. Now, covering one eye. Look at the light. Good. Perfect. Just seeing how your pupils react to the light. Nice. Very good. Now I have this color blindness test, and you're just going to tell me what number you see. Starting with this page, what number do you see? Good. What number? Right here. Good. What number here? Good. What number here? What number here? Changing the colors. What number? And one number here. Good. And change again. What number? And what number? Great. What number here? Good. What number? And what number here? Fantastic. Okay, you did really good. I don't think you have color blindness. You passed. You got them all correct. So that was fantastic. Now we're going to focus a bit on your ears. So I have this tool here that's going to blow some air in your ear. So let me know if it feels weird or you feel pain or uncomfortable, okay? So stay still. Good. Now let's do that other ear here. Okay, stay still. Perfect. Okay, so that didn't bother you, right? Great. Okay, now we're gonna use this tuning fork here, and I want you to tell me when you no longer hear this sound, okay? Good. Very good. Very good. Fantastic. Okay, now we're gonna do kind of a different hearing test here. I'm gonna use my hands and make that sound. Okay, so tell me what ear you hear that sound, okay? All right. sounds fantastic too. All right, so looking at everything, it looks like you are super healthy. Your eyes look really good. Your ears look really good. Not worried about anything else, that you're sick or anything. So this was a perfect exam. But yeah, it was very lovely to see you, and I hope you have a lovely rest of your evening, okay? Alright, I'll see you around. Bye. Hello, welcome in. So, you have a doctor's appointment today, so I'm just gonna put some gloves on. And we're just gonna get started, okay? So, could you tell me the reason why you're here today? Okay, so you have a bit of a cough. Gotcha. And how long have you had that cough for? Okay, yeah. You know, it's winter, holiday season. You get together with all your family, your friends, and, you know, people spread illness and all that. So, and the weather is really cold, so that's probably what's going on. So we're gonna make sure that everything is good though, okay? All right, so we're just gonna start off by getting your temperature. So I have this temperature gun here, and I actually have two. So this one goes in your ear and this one goes in your forehead. So we're gonna do the forehead one first. So just stay still. Okay. All right, now let's look at this one. So this one's gonna go in both of your ears inside. So try to stay still for me, okay? Okay. One sec. Okay. Now let's do one more on this side here. So okay. So I can definitely see why you're feeling that way. Your temperature is a little bit high, but we're just gonna get to the bottom of this, make sure that you come out here with a plan to get to feeling better, okay? All right, so we're just gonna do a checkup today, like I said. And I have this flashlight here. I just want you to follow the light, okay? Let's follow the light. Is the light too bright for you? Okay, doesn't burn your eyes, does it? Okay. Do you wear contacts or glasses? Gotcha. Okay. Very good. All right, now I want you to look at my nose and tell me when you see the light. Good. Oh. Good. 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 Okay, same thing. Just look at my nose, nowhere else, and tell me when you no longer see the light, okay? So just look at my nose. I know the light is kind of bright in front of your face. Just stay looking at my nose, okay? Don't move your eyes. Let me know when you no longer see the light. Good. All right, fantastic. Nothing wrong there. Okay. Now I want you to close your eyes, and I want you to tell me if you can see the light pass through your eyes, okay? So close your eyes. Can you? Oh, you see this light? Good, okay. Good. Good. Now I have this tool here and I'm gonna look inside of your eyes a little bit deeper. Okay, so just stay still for me. Keep your eyes open. Good, okay, same deal here. Keep your eyes open. Very good. Okay, was that light too bright for you? Good. Yeah, your eyes are looking really good so far. Okay, so I want you to close your eyes for me. I'm just going to touch around your eyes. I'm just going to see if there's any like congestion around. That's probably the cause of your cough and what's going on there. All right, so close your eyes. I'm just going to palpate and touch around, okay? Okay, now palpate. Okay. Do you feel any pain there? Okay, I definitely feel like a little bit swollen here. Which definitely can be the cause of what's going on. Okay, going back to the eyes now, I'm bringing my light back. Okay, why don't you look at my nose? All right. Okay, let's look at my nose. Okay. All right. Okay, look at my nose. Now look at the light. Look at my finger. Okay, look at the light. Look at my nose. My finger. Keep looking at my finger. Now the light. Now my nose. Now my finger. Okay. Look at my light. Look at my light. Only the light. Okay, look at my nose. Now the light. Now my finger. Look at my finger. Just my finger. Now look at the light. Okay, good. All right, now I want you to look at my finger. Right, look at it. Keep looking at it. Good. All right, keep looking at it. Good. Okay, now look at my light again. Just look at my light. And over here, I'm going to be showing you some numbers with my hand. So I want you to tell me the number, but you need to be looking at my light here, okay? Okay, ready? Very good. Okay. Keep here. So, okay, I'm going to cover one of your eyes. Okay. And I want you to follow this red light. Okay. Good. Very good. Good. Now your other eye. Okay. now tell me how many times it blinks. Good. Now we're going to do your other eye. Tell me how many times it blinks starting now. Okay. How many times was that? Very, very good. Okay. So I'm just going to lastly check the distance between your pupils, and then we can keep going with our exam. Okay, so just look at my nose here. Very good. Okay, and it stayed the same as last year. Okay. Okay, so now we're gonna move on, and I'm going to take a listen to your heart. Okay. All right. Okay, so sorry. Okay, so I'm just gonna put this on your chest, and I want you to take a deep breath for me, okay? All right. Deep breath. Good. One more deep breath. Good. One more. All right, now I want you to just breathe normally for me. Okay. Good. Good. Keep breathing normally. Okay. Now I'm just gonna go up behind you. Okay. Same thing. I want you to just breathe deeply, okay? Just 3 times. 1, 2, 3. Very, very good. Okay, now we're going to do some normal breathing. Okay, so I'll stay right behind you. Right. Right behind you, okay? So just keep breathing normally for me. Okay. Just keep breathing normally. Okay, very good. Very good. Okay, very good. Okay. So, I'm definitely hearing some wheezing. So, it's probably causing the coughing. I also felt some congestion as well. So I'm going to touch around your throat, your lymph nodes, around here, okay? So tell me if there's any pain or you feel uncomfortable, okay? Right. Okay. You do feel a little swollen. Okay. Probably why you're feeling pretty scratchy around here. Okay. So I want you to open your mouth for me. I'm gonna look in with the light, okay? Open your mouth wide. I'm just gonna look. Good. Okay. I see some redness there. Okay. All right. Yeah, definitely see redness. So, sore throat could be strep throat. So, I'm just going to continue our exam. I'm going to check your ears because a lot of the time, all of this travels to your nose, your ears, your throat, your mouth, all of that. So all of it's connected. So if one's kind of wacky, the rest is too. Okay, so I have this here, this otoscope, and it's gonna go inside your ear, and I'm just gonna look inside to see if there's any redness or any clog, or if it's clogged. Okay, so I'm just gonna look in this ear here. So stay still. I do see some redness and some wax buildup there. Right here, we're gonna look now. Okay, so I'm seeing about the same there as well. Yeah, that's probably what's causing all of that too. They're all connected, the nose, throat, ears, all of that. So, like I said, if one of them is kind of if one of them is kind of wonky, all of them are gonna be wonky. Okay, so I'm just gonna touch around your ears. Let me know if you feel any pain, any pressure, okay? Any pain there? Okay, now let's do this ear. Okay, any pain? Good. Okay, I'm gonna cup your ears. Let me know if it feels weird. Okay, do it one more time. going to be doing a hearing test on you really quickly. I need you to close your eyes. I want you to tell me how many times you hear that sound, okay? Close your eyes. Okay, how many times was that? 12. Okay. Now I want you to tell me what side you hear it and how many times you hear it on that side, okay? All right. Okay, so what side was that? And how many times did you hear that sound? Good, 5 times. All right, let's continue. Okay, so what side do you hear the sound? How many times do you hear it? Okay, so what side was that? Good. And how many times did you hear it? Okay, so it should be 8, but the first one was kind of quiet. So if you didn't get it correct, it's okay. So I'm gonna blow some air in your ear. Let me know if it feels uncomfortable, okay? Okay, good. And now, let me see. So I have a tuning fork here, and I want you to close your eyes and tell me what side you hear the tuning fork, okay? What side was that? Good. What side? Good. What side? What side? Great. Now keep your eyes closed, and I want you to tell me when you hear the sound stop. Good. 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 Very good. You can open, actually, no, keep your eyes closed. I'm going to do one more test, okay? I'm going to make this sound next to your ears, and I want you to tell me what side you hear it. Good. Great, that was both. Okay, now I want you to tell me how many times you hear that sound, regardless of what side it's on, okay? Okay, so how many times do you hear that sound? Good, that should be 12 times. All right, so we are done with your exam today. So basically what I see is that you have a lot of congestion, your nose, around your throat, your ears. The ears have a little bit of redness in that they're kind of clogged along with your nose and your throat, or the throat has a lot of redness. So what I'm thinking is that we are going to give you some cough medicine and some nasal spray and eardrops, just so you can work on every single aspect and get it back to normal. So I would say you should just be taking this medicine for about a week, and if you don't get better within that time frame, you should definitely come back so we can give you another exam and make sure we can rule out more things that could be going on. But I'm thinking it could be like strep throat and then just congestion from being sick, where the ears are involved in the nose. But I definitely see the biggest issue with your throat, so that medicine is definitely going to help, okay? But yeah, that is it for the exam today. Thank you so much for letting me examine you, and I will see you around. Okay, have a good evening. Bye. Hi, so I hear you're not feeling that great today. Okay, can you tell me what's going on? Okay, gotcha. Okay, so how long have you been feeling sick like this? Okay. Gotcha. Okay, well, no worries. We are going to look into this right now. So, right off the rip, I just want you to look at my light, okay? Alright, now follow. Good. Okay. Okay, now look at my nose. Just look at my nose. Don't look at the light, just my nose. Good. My nose. Okay, now look at the light. Now my nose. Now my finger. Good. Okay. Look at the light. Now look at my nose. Now look at my finger. Very good. Okay, can you follow my finger? Good. Okay. I'm just gonna get your temperature and see what's going on here, okay? So stay still for me. Let's look. Now what we're going to do is use this other one, because I just want to be 100% sure that everything's looking good. So this one is going to actually go in your ear. So stay still for me, okay? So ready? I'll put in this ear first, right here. Okay, now we're going to put in this ear here. Stay still for me. Okay. Yeah. Okay, not that great of a temperature. Yeah, you do look really sick. So we're just going to do a little checkup on you, making sure that everything is looking good regardless, okay? So, and then we'll find out what exactly you need at the very end, okay? Okay, so I just want you to open your mouth for me. Okay, say ah. Okay, just gonna look. Alright, yeah, I do see redness. and swallow. Okay. Now open your mouth again. Okay. Now, I'm going to touch your neck here, and I want you to swallow again, okay? I'm just going to feel that. Okay. Good. You can swallow. Very good. Okay. That feels pretty good. Okay. I'm going to replace the top of this. Okay. And I'm going to examine inside your ears. Okay, so we're going to start off with this ear first. It's going to look inside. I do see like a little bit of redness in your throat, but I want to see if there's any redness inside your ears, okay? So I'm going to start off with this ear here. Okay, stay still for me. Of redness there. And now let's look at this ear here. Okay, so stay still. So looking at both ears, they look pretty clogged up and a little bit red. So I just want to check your nose really quick. So just look up for me. Okay. Yeah, you look very congested. Okay. So what I want you to do now, just going back to the ears, I want to make sure that your hearing isn't affected by that clog, by it being clogged and the redness. So we're just going to do a little test here. So I want you to close your eyes and tell me when you hear that sound, okay? Okay, so close your eyes. Okay, ready? Did you hear it? Okay. Okay. So now I want you to tell me on what side you hear it. Good. Very good. Okay, now I have this little tool that makes a sound. Okay, so I want you to tell me when you hear that sound, okay? Now we can begin. Okay, very good. Now I want you to tell me what side you hear that sound. Very good. Okay, one more. With hearing, I have a tuning fork, and if you don't know what that is, it sounds like this. Okay, so I want you to tell me when you hear that sound, okay? Actually, I want you to tell me when you don't hear the sound anymore. open your eyes now. So even though your ears are clogged and there is redness, I don't see anything that is affecting your hearing. So I'm not worried about that at all. Okay. So now we're going to look at your eyes. Just stay still for me and keep your eyes open. Okay. Okay. Can you look up for me? Okay. Now can you look down? Left. And now look right. Good. Okay, now we're gonna do that on this side. Okay. Look down for me. Look up. Now look to the right and to the left. Very good. Okay, I'm going to cover one eye. Let me know when you see the light. Okay, good. Good. Now, other side, same thing. Tell me when you see the light. Great. Okay, I'm just going to get really close. I really want to see your eyes, so try not to blink here. Good. Okay, I'm gonna look at this eye here. Try not to blink for me. Okay, very good. Okay. We're gonna follow the light. I want you to tell me when you no longer see the light, okay? So it's going to start right here. Don't move your eyes at all. Just stay looking in this area right here by my nose, okay? Tell me when you no longer see the light. Very good. Fantastic. Okay. Not worried about your eyesight at all. Okay. So now I have to look and listen to your heart. So, okay, I'm just gonna put this right here. Okay. So take a deep breath for me. Ready? Good. Very good. Okay. Now breathe normally. Good. Okay. Take another deep breath for me. Okay. Breathe normal. Okay. Now can you cough for me? Good. Okay. Yeah, I do hear some wheezing there. Okay. I'm just gonna get the back. Okay. So behind you. I have this behind you. Can you breathe normally? Okay. 3 deep breaths. Ready? 1, 2, 3. Good. Okay, now I'm gonna go right here. Same thing. Okay, so I'm behind you. Now I want you to breathe normally. Okay. Very good. Okay, now 3 deep breaths. Ready? 1, 2, 3. Okay. Okay, now I want you to do 1 cough for me. Okay. All right. Very good. So, I am hearing wheezing. Makes sense though, because I can see that you're very congested, you're sick, so totally normal. Okay, so right now what I'm gonna do for your ears, I'm just going to blow some air in your ears, try to relieve that redness and the irritation there. Probably can help with the clogging, okay? Okay, so just stay still for me. I'm just gonna put this in your ear. Good. Now we're gonna do this one. Okay, I have another tool here. Okay, same thing. Just gonna blow air in your ears. Here. Okay, hopefully that helps with that redness and that clogginess. Okay, so now let me see. Here it is. Okay. Now I want you to look at this. Follow it. Okay. Now keep following it. Keep following it. Keep following it just with your eyes. Okay, right now I'm just gonna palpate around your face. I just want to see, because I do see like some like you're clogged around your nose. You have some redness on your throat, and your ears are clogged. I just want to see if you feel any pain around this area. Okay. Okay, so I'm just gonna touch your face, palpate like this very gently. Okay. Does that hurt? Good. Okay, now I'm just gonna touch your face. I'm gonna try to massage that area. Try to release that pressure. Maybe that can help with the congestion. Okay, so stay still. Very good. Okay. I'm going to massage around your neck as well. Is all that we can really do for you today, but I'm going to be sending you some medicine. That's honestly what's going to help you the most. What I just did, the palpating and then the massaging of your neck and around here, will probably help relieve it for today, but if you take your medicine, you'll be feeling way better way quicker than that. Okay, just gonna write down some notes. But yeah, I think you just have the flu right now. It's not too severe, so I'm just gonna give you some medicine just for the week. Okay, I'm not seeing like any strep throat or ear infection or anything. I think it's just being clogged from the flu, like your nose, your ears, your throat. Okay. Yeah. So we'll be sending you home with that medication, and if you feel worse at all during the week or after the 7 days you're not better, you can give us a call. We'll book another appointment for you, but I think the medication is going to make you feel totally better by the end of the week. Okay, so nothing to worry about. I think you'll be fine. Okay, it was very lovely to meet you, and I hope you have a lovely rest of your evening. Feel better. Hi, how are you? Good. So you're here for the yearly checkup, is that correct? Okay, good. So, can I get your first and last name? Okay. And how do you spell your last name? Gotcha. Okay. All right. Have you been sick in the last week? Okay. Good. Do you have any concerns? I know you said that this is a yearly exam, but anything that is concerning you about your health at all? Okay. Gotcha. All right. Perfect. Just gonna write a couple more things down and then we can get started. So I'm just going to start off by getting your temperature. We have 2 temperature guns. That's one for your forehead and your cheeks, and one that goes inside your ears, okay? So we're going to start off with the one that goes on your forehead. So stay still for me, and I'm just going to press this button here. Okay, now it's going to go on your cheeks. Okay, and on your other side. All right. right, great temperature. We have this temperature gun here. This one is going to go inside your ear, like I said before. So just stay still for me. Try not to move. Okay, so we're going to start off putting it in this ear here. Okay, so stay still. All right, good. Great. Okay, now other side too. Stay still for me. Okay, your temperature is perfect. Nothing to worry about there. So right off the rip, I'm just gonna look at your eyes. All right, so just look at my light. Okay, is the light super bright? Does it bother you at all? Okay, can you follow the light? Follow without moving your head. Good. Very good. All right, fantastic. Okay. I am going to just listen to your heart. So, all right. So stay still for me, okay? And I need you to breathe in very deep, okay? All right, can you breathe normally for me? Good. All right, and can you cough? Good. All right, so everything sounded really good. Your heart sounded great. Your lungs sounded good. Fantastic. Okay, now we can move on. So I have this here. Can you look at my light? Okay, look at my light. Now I'm just gonna look at your eyes, okay? Can you follow the light? Good. Okay, I want you to look at my light. And I'm going to use my hand to show you my fingers, okay? And I want you to count how many fingers I'm holding up, okay? But look at my light. Okay, how many fingers? Good. 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 Great, okay. Now look here. Look at this light here. Look at this light. Same thing. Good. Look at the light. Great. Very good. So I'm just going to replace the top. And I'm going to look in your eyes a little bit deeper. Okay. We have this here. Right. Okay, and you can look at my nose. I just want to see how your eye reacts to the light. Okay, look at my nose. Now look at the light. Good. Alright, so I have this pen here, and we're just gonna go through it, and you're gonna keep switching what you look at. So, okay, look at the light. Look at my nose. Good. Look at the pen. Good. Look at my nose. Look at the pen. Look at the light. Good. Look at the light. Look at the pen. Look at my nose. Look at my light. Look at my pen. Look at my light. Look at my nose. Good. All right, we're gonna do this, and the light is gonna be on the other side. Okay. So, look at my light. Now look at the pen. Look at my nose. Look at the light. Now my pen. Look at my nose. Look at my pen. Look at the light. Look at the pen. Look at my nose. Okay, good. Look at the light. Look at the pen. Look at my nose. Great. Fantastic. Okay, so I'm gonna keep looking at your eyes. I'm just gonna open. Okay. Just gonna look. Good. Can you look up for me? Can you look down? Can you look left? And can you look right? Great. Okay, same thing on the other eye. Okay, can you look up for me? Can you look down? Now look to the right and look to the left. Good. Okay, so I'm going to cover one eye. All right, do you see my light? There you go. Do you see my light? Okay. Do you still see it? Do you see my light? Do you see my light? Do you see the light? Do you see my light? Do you see my light? Good. Do you see my light? Do you still see it? Do you see my light? Good. Other eye. Okay. Alright. Do you see my light? Do you see my light? Do you see the 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 light? And do you see the light? Very good. Okay, follow this light. Just your eyes. Very good. Don't move your head. Okay, just follow. Beautiful. Great. Okay, so I'm just going to be checking your color blindness. Okay, so you have this book and there's a bunch of different numbers. So I want you to tell me the number that you see. Some are a little challenging, okay? So no need to worry. All right, so let's get started. What number do you see? Good. What number do you see? Good. What number? Good. Okay, now it's going to look a little different now. What number do you see? Good. What number do you see? What number do you see? What number do you see? Okay, here you go. What number do you see? What number do you see? What number do you see? And what number do you see? Very good. There's no numbers in these, so it's a little tricky. I guess you can kind of see some numbers here, but no numbers. You did a fantastic job. Your color blindness, you don't have any, so nothing to be concerned about. Okay, so I'm going to take my tablet here. And we're just going to open something quickly. Let's see here. So we have this chart here. I'm sure you've seen it a whole bunch. Okay. Now, looking here, can you read that top letter? Okay. Okay, can you read the furthest line, or whatever last line you can see? Can you read it for me? Okay. Good. Okay, so what color is that here? And what color is this? Good. All right, fantastic job. Okay. Now stay still for me. I just want to measure your eyes quickly. Good. Just gonna get my light here. Very good. All right, we are done with that, with your eyes. Very good. I haven't seen anything that is concerning. Your eyesight is really, really good. No color blindness. I don't see any redness in your eyes. So we can move on to the next portion, which is an ear exam. Okay, so I'm just going to switch this tool top. Now, I'm just going to put this otoscope in your ear, and it will allow me to look inside, and I can see if you have any wax or anything, any redness, any irritation, anything like that. So what's very important though is that you stay very, very still and try not to move because this is going to be inside your ear, okay? All right, don't worry, this is not going to hurt you at all. I'll be very, very gentle. Okay, so we're going to start off with this ear here. So I'm just going to be putting it in your ear, and just stay still like I said. Okay, we're about to go in now. Okay, really, really good. I'm gonna be checking this ear now. Stay still like I said. Okay, we're about to go in right now. Ears looked super healthy. Again, nothing to worry about inside. I'm just going to look at the outer of your ear now. So I'm just gonna look at this ear, okay? So stay still. I'm touching your ear, okay? I have gloves on, no worries. Does me touching your ear irritate you at all? Do you feel uncomfortable? Okay, good to know. Okay, now let me touch your next ear. Like I asked before, do you feel any irritation? Do you feel uncomfortable at all? Okay. All right, good. The fact that I'm not really seeing any like bumps or lumps or anything like that, so I'm not worried about that. Okay. Let's see. Okay. Okay. Yeah, that's basically it. Actually, we have one more thing. So I'm going to blow some air in your ear. Let me know if that makes you feel uncomfortable or any discomfort, okay? Alright, so I'm just gonna blow some air with this. Good. Okay, now I'm just gonna touch both of your ears now. Alright, good. So, forgot to actually have this tuning fork here. So, I need you to close your eyes and I want you to tell me on what side you hear the tuning fork, okay? Good. Good. All right, now tell me when the sound stops. Good. Good. Great, fantastic. Okay, nothing to worry about there. Okay, now I think what we're gonna do is, I think you're gonna keep your eyes closed, and I'm gonna make this sound. And I want you to tell me if you, on what side you hear that, okay? All right, so close your eyes, okay? So we're done with your ears, your eyes. So now we're just gonna do like your face and just your overall like checkup, okay? So we're gonna start off by looking at your throat, inside your mouth, your throat, your teeth, all of that. So can you open your mouth wide for me? Okay, good. Just gonna look at your teeth, looking at your tongue, your throat. Okay, can you say ah for me? Very good. Okay. Yeah, everything's looking good. I do see a little bit of redness in the back of your throat, but I think you might just be potentially getting sick now that the weather is changing. So nothing to worry about. You might have a little bit of a sore throat. Okay, you can stop now. Okay, so I'm just gonna touch along your face, okay? So tell me if you feel any pain, okay? Good. Good. Now, okay, now I'm gonna palpate your face. So it's just a little tap on your face, and let me know if you feel any discomfort. Very good. Okay, we're gonna do the same thing, but with this hammer. So I'm just gonna hit your face. So I'm gonna start off with on this side of your face. Let me know if you can feel that. Okay, good. Other side. Great. Okay, very good. Now I'm just going to examine your face with this light. It's much brighter light. Just want to look at your skin. If there's anything going on. You look very good. Very healthy. Alright, good. Okay. So, lastly, I'm just going to measure your face. So I have this measuring tape. Okay. Stay still. I'm just going to get your measurements, so how tall you are, your height. Okay, stay still, try not to move. Get it all the way at the bottom. Okay. Good. Okay, so you haven't grown since the last time you were here. Nothing has changed either with those measurements. Okay. So that is it for our exam. Let me just get my journal and write down some notes. Okay. Okay. to be worried about at all. Everything looked fantastic today, super healthy. Everything looked really, really good. The only thing, I did see a little bit of redness on your throat, and I'm thinking it's just weather's changing, it's getting colder, you know, Halloween's coming, and it gets cooler around that season, so I think that might be why you have a little bit of redness, especially since it's not irritating you at all. But yeah, what you can do if it does, maybe start off with like a cough drop. If you feel like more pain, you can definitely come in and we could take another look. But other than that, super healthy, nothing to worry about. Yeah, it was very lovely to see you again, and I hope you have a lovely rest of your evening. All right, see you later. Bye. Hi, I'm Miss Rose, and today we are going to be doing a checkup on you, and lucky you because it's raining outside, so it's going to be super relaxing. All right, let's start by getting your temperature. All right, just going to be scanning your forehead, then both of your ears. Okay, so stay still for me. Okay, now we're gonna do your ears. Okay, and your other. All right, great temperature. So I'm gonna be putting on some gloves. Okay, so I have these blue ones. I always have trouble putting them on. They're pretty tough. Okay, got the first one on. Alright, I have both gloves on. So what I'm going to do first is just examine your face. I have a light here, and I'm just going to touch your face and shine a light. I just want to make sure everything is looking good. Now I want to look at your eyes. I'm just going to shine a light. Okay, can you blink for me? Okay, keep blinking. Just gently blink. Okay. Alright, keep your eyes closed. Alright, do you see the light shine on your eyelids? Okay. Alright. Do that again. Do you see that light shine on your eyelids? Great. Okay. I'm just going to palpate your face. Alright, so you can close your eyes again because I'm going to be palpating by your eyes too. I'm just going to hit your face like that. It's super gentle. Just want to see how you kind of react to it, okay? Alright, so keep your eyes closed. Alright. Okay, that was good. Just gonna keep touching. Alright, touching your ears. Okay, so you haven't felt any pain, correct? Good. I'm just gonna keep going. Alright, good. Now what we're gonna do is I'm gonna get your heart. Not get it, but you know. I have this, and I'm just going to look at your breathing, your lungs, your heart, okay? Okay, so I need you to just breathe normally for me, okay? So I'm gonna put this right here, alright? It's kind of cold. Alright, breathe normally for me. Good. Good. Okay. Now I want you to take a deep breath, okay? Good. Okay, more deep breaths for me. Doing good. Alright. Your heart, your lungs looks really good. Now we have this for your blood pressure. And all you have to do is lay your arm flat, and I'm just going to wrap this around your arm, okay? Okay, so stay still. Okay. Right. This on you. Alright, good. Alright, good job. Now I'm gonna look in your ears with this otoscope, okay? So just stay still, try not to move, and just look at this ear first, okay? Alright, good. We're gonna look at this ear. Okay, I'm just gonna go over here. Stay still for me. Okay. Great, your ears look good. Okay, I'm gonna replace the cap and we're gonna be looking inside your mouth. So I'm just gonna replace it. Okay, new cap on. Alright, so can you open wide for me? Open your mouth wide. Open your mouth wide. Okay. I'm just gonna be looking inside your mouth. Okay. Alright. You say ah. Okay. Alright, your mouth is looking good. Now we're going to be looking at your eyes. Now I have this top for your eyes. Okay, great. Alright, so I just need you to keep your eyes open. I'll let you know when you can blink, okay? Alright, keep them open. Alright, blink. Okay. Okay, now you can blink whenever you need to. Have you felt any pain in your eyes recently? Okay. I do see a little redness, but you know, it's springtime, a lot of pulling out, different flowers growing, trees growing, so might be just a factor of that. So I'm not too worried. I do see a little bit of redness in both eyes. You said it doesn't hurt, correct? Alright, good. Okay. Alright, that's good. I have my other light, and I'm just gonna shine it in your eyes. And I want you to follow the light. Follow the light. Okay. Follow, even when my hand is in the way. Okay. Alright, I'm gonna cover one eye, and I want you to follow, okay? Follow. Good. Other eye. Just follow the light. You're doing really good. Great. Okay. So now I want you to look at my light. Okay. Look at my light. And I want you to tell me what finger I'm holding up. So it's going to be right here. Okay? Tell me what finger I'm holding up. Good. Keep looking at the light. Good, okay. Other side. Right. Okay. Just keep looking at the light. Don't look anywhere else but the light. Alright, good job. Now I want you to look at my nose, alright, and tell me when you no longer see the light, okay? So when the light leaves your vision, so look at my nose, look at my nose, look at my nose. Keep looking at my nose. Oh, sorry. Good. I have these two lights, right? They're kind of similar. Can you tell me what is this color? Okay, and what's this color? Good. Alright, tell me what this color is. And this one? Good. And what's this color? And this one? Okay. This one? And this one? This one? And this one? Okay. Now what are the two colors? Great. Okay. Now I want you to follow the green light. Okay? Follow the green. Okay. Good, now follow the blue. Good. Alright, good job. Okay, so now I have this book and it's for color blindness. Right. So we're going to start with this number. Can you tell me what the number is? Good. Alright, what is that number? Good. And this one? Good. And this number? Good. This number? Okay. This number? Good. This number? Okay, so it's gonna look a little different now. Okay, changing it up. This number? This number? This one? This number? This one? This one? This one's a little harder. 73. Can you see a number here? Okay. How about here? This number? This one? 42. Can you see a number here? Okay. Can you see a number here? Alright. You are all finished. You did a great job. You got them all correct. Good job. Okay. Alright, so now we're going to move on to your ears. And let me just switch this out again because we are going to be putting the otoscope back in your ear. Alright, so I'm just going to get a more, I guess, accurate or more in-depth look into your ears with the otoscope. When I did before, I was just going to see if there's any redness. Didn't really look much into it. So we are going to put this back in your ear and we're just going to be doing some tests, okay? Alright, so I'm going to start off with this ear here. So I'm going to go to the side of you. Please make sure to stay still, okay? Alright. Alright, I'm going in right now. Ear is looking great. Alright, now let's do your other ear. So this one here. I'm just gonna get right next to you. Alright. Job staying still. Your ears are looking really good. A little bit of wax, but no redness, which is really awesome. Okay, so what we're gonna do now is I'm just gonna touch your ears, make sure you're not feeling any pain. Okay, so just let me know if you do feel anything, okay? I'm gonna cup your ears. Okay. Any pain? I said you had a bit of wax, we are going to be removing them with this fan. Okay, so just stay still for me. Switch. Good. I'm just going to be blowing some air in there. Okay, so just to remove that wax. Other ear. I have a tuning fork, and I want you to tell me what side you hear the sound, okay? So I need you to close your eyes. Alright, so tell me left or right. Good. Okay. Same thing, we're going to use kind of a beep test, and what you're going to do is tell me what side you hear the sound. Okay, so this one's going to be kind of all over the place, so like it won't happen right away. It might take a few seconds until the next beep comes, okay? So just wanted to let you know. So close your eyes and tell me either left or right, okay? Okay. All right, good job. All right, so I'm just gonna look at your face one last time. So I have a different light. It's a lot brighter. Okay, just want to look at your face before we end our appointment. Okay. All right. Okay. So that is it for your appointment today. You did a lovely job. Everything is looking super healthy. But yeah, it was very lovely to meet you, and I hope you have a lovely rest of your evening. All right. I'll see you around. Hi, let's start this eye exam on you. Okay. Is the light too bright for you? Does it hurt your eyes at all? Okay. Can you follow the light without moving your head? Just use your eyes. Good. Have you had any issues with your eyes? Do you wear contacts or glasses? Okay. I want you to look at my nose, and I want you to tell me when you see the light leave your vision, okay? So, look at my nose. Good. 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 Great, you did very good. Now I want you to tell me when you see the light enter your vision. So keep looking at my nose for me, okay? Fantastic. Okay, I'm just gonna get your temperature quickly. Make sure you're not sick. So we have this temperature gun here. Okay, so I'm just gonna put it in this ear. Stay still because this is going in your ear canal and I don't wanna actually go too deep. Okay, so just stay still for me, okay? Good. Okay, now we're gonna do it again, but on this ear here. Okay, just try to stay still for me. Okay. Okay, let's see. Okay, very good. Your temperature looks fantastic. All right. Now what we're gonna do is just examine your eyes with this tool here. So I want you to try not to blink because I'm gonna look really deep in your eyes, checking out that pupil and everything, just making sure everything's looking healthy, okay? So let's just try not to blink. This is gonna be really close. Okay. Alright, go ahead, you can blink. We're gonna do this other eye here. Okay. Alright, now keep your eyes open for me. I'm gonna get really close. You're doing great. Okay, good. You can blink. Alright. Now I'm just gonna look inside your eye. Okay. I'm gonna touch your eyelids and extend them open so that I can look deeper. Okay. So just stay still. Alright. Now I'm gonna give you some instructions. Can you look up for me? Good. Now, can you look down? Now, can you look to the left and to the right? Very good. We're going to do the same thing with the other eye. Okay, so I'm just going to open your eyelids. Good. Okay. Now, can you look down for me? Okay. Now look up. Look to the left and to the right. Great, thank you. Everything looks really, really good. Okay. I'm gonna cover one eye. Okay. And I want you to tell me what color this is. Okay. All right. Now follow that light. Very good. Try not to move your head, just use your eyes. Perfect. Now we're going to do the other eye. One moment. Let me get the right color. Okay. I'm going to cover your other eye. Oh, turn off. Here you go. Now, what color do you see? Great, it's green. Okay, now with your eyes only, follow the light. Very good. Very, very good. Covering your eye again on the other side. Okay. I want you to look at my hand. Okay. I'm going to be putting some numbers using my hands. Okay. And I want you to tell me the number you see. Okay. All right. Let's begin. Perfect. Let's do the other eye. Just gonna cover it up. Okay, good. All right, so other hand, same deal. We're gonna be doing the same thing. Just tell me the number you see, okay? All right, let's begin. Beautiful. You got them all right. So great job there. Okay. So right now what we're gonna do is go back kind of with the colors. So I have these colors here. I'm gonna cover your eyesight with them. Okay. Let me get my flashlight. So, covering your eyesight with this color. What color do you see? Good. Now I'm going to trace a shape. I need you to tell me what shape you see, okay? What shape is this? Beautiful. A square. Okay, what shape is this? A circle, good. Last shape for this color. What shape is this? A triangle, very good. Now let's switch colors. Now we have this color. What color do you see? Good, should be red. Now let's start with the shapes. What shape do you see? Good, a circle. Very, very good. Okay, what shape is this? A square. Very good. And what shape is this? A triangle. Fantastic. We have one more color. Okay. Now what color is this? Very good. Okay, now I'm just going to trace the shapes again. What shape is this? A square. Very good. What shape is this? A circle. Fantastic. And what shape is this? A triangle. Very, very good. You got them all correct. Now we're going to continue with color. And I have this color blindness test here. And there's going to be some numbers and a circle with a lot of colors. So all I need you to tell me is the number you see in the middle of the circle, okay? Great. So let's begin on this page. What number do you see? Good. What number do you see? And what number is this? Good. What number is this? And this number? Good. Okay, let's change it up a bit. What number is this? This is a little bit harder. Good. What number is this? What number is this? And what number is this? Good. Okay. So starting right here, can you trace your finger along the lines that you see? Okay. Until you get to this side. Very good. I'll show you how to do it. Okay. You could have went this way, or you could have went this way. Great. Okay. So you passed the color blindness test. So I have no worries about that at all. So now I have some lenses that we are going to try on you to see if your eyesight has changed at all. So let's begin. So you're going to tell me which lens is better, okay? So we're going to start off with this, okay? Just like that. So lens 1 or 2. 1 or 2. 1 or 2. Okay. Now lens 3 or 4. 3 or 4. 3 or 4. Good. That is going to be pretty strong, okay? So lens 1 or 2. 1 or 2. 1 or 2. Okay. Alright, so these are going to be the last ones here. So lens 1 or 2. 1 or 2. 1 or 2. Okay, so they seemed pretty even to you. So I think your eyesight has pretty much stayed the same. I'm going to be measuring your eyes, just the distance between your pupils. So stay still. Okay, perfect. So your the same. I'm just going to measure with this measuring tape. So just look at my nose. We're good there. Now we're going to be testing your eye sensitivity. So just look at my nose. Okay. Just going to blow some air. Good. Try not to blink. Good. Okay, now blink, blink, blink. Okay, we're going to do the same thing, but with this tool. So, blink, 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 and now open your eyes. Try not to blink. Good. We're going to do it one more time with this tool here. So, try not to blink. I'm gonna try to look at your eyes and see if there's any irritation. So stay still. Look with this light. Okay, I don't see any redness. You weren't tearing up either. That's very good. Sometimes people get really sensitive to those tests and they start tearing up, or they don't expect and they try to blink before the air gets blown in their eyes and it irritates their eye. But your eyes look fantastic. So I think we are done with your eye exam test today. Everything looked perfect. Your eyesight has stayed the same, so nothing I'm worried about. But yeah, thank you so much for letting me examine your eyes, and I hope you have a lovely rest of your evening, okay? Can you look at the light and follow it? Follow the light with your eyes and not your head, okay? Just follow the light. Follow it. Okay, good. Right. Does the light hurt at all? Is it too bright? Okay, good. Just keep following it. Very good. Okay. You're doing really good. Okay. Now look at my nose and tell me when the light leaves your vision, okay? Look at my nose. Don't move your eyes. Okay, good. 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 Very good. All right. enters your vision, okay? Very good. Good. Okay. I'm just gonna look at your eyes. I'm gonna touch very gently. All right. Can you look up? Okay. Now look down. Look to the left and to the right. Very good. We're going to do the other eye. Okay. Touching very lightly. Okay. Look down and look up. Look left and look to the right. Very, very good. Okay. Was the light bothering you at all? Was it super bright? Okay. I have a different light. Can you tell me what the difference is between this light and this light? Okay. So this light is a little brighter. Okay. This one is also smaller. Okay. So, same deal here. Let me know. Is it too bright for you? Okay. Okay, not bright. That's good. Okay. Okay, I'm going to touch your eyes. So I want you to tell me if it bothers you at all, if you feel uncomfortable. Very good. All right, so I'm going to look at your eyes with a different light. Okay, just replacing the top of it right now. Okay, so we have this here. Okay, so I'm just going to look at your eyes. Stay still. I'm going to get kind of close. All right. So keep your eyes open. Don't blink. Very good. Now we're going to do the other eye. Same thing. Try not to blink. Okay. Okay, good. Can blink, 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 blink. Okay. Just follow this light for me. All right. I want you to look at the light. Okay, look at the light. Okay. So just look at the light. Tell me how many fingers I'm holding up. Good. Other side. All right, just look at the light. Ready? looking at your eyes, looks like there's something stuck in there. Maybe an eyelash, I think. So we're gonna try to take that out for you today. Okay. Does this light hurt at all? Okay. Right, tell me when you can see the light. Good. Okay, so yeah, it's looking like you have something stuck in your eye, so we're just gonna take that out for you. So right now I just want you to close your eyes and move your eyes around. Just want to see if that's like irritating you at all. So just move your eyes, okay? Good. Alright, so how does that feel? Did that hurt at all? No. Okay. So I have this syringe here. I'm just gonna put some drops in your eyes. So open. It's not gonna hurt, okay? Right, so just gonna do 2 more drops. And 1 more. Good. Okay, now the next eye. Good. 2 more drops. 1 more. Very good. Okay, so I have this very, very gentle tweezer. I'm gonna try to remove it from your eyes, okay? So stay still. Good. No, don't worry, this happens all the time. Sometimes eyelashes just fall into your eyes. Very good. Now I'm just gonna blow some air. Good. Very good. Alright, I'm just gonna look at your eyes again. Let me know if the light is irritating you. Good. Okay, so you're definitely able to remove that. I'm just going to wipe away any lashes that are loose so it doesn't happen again. So close your eyes for me. Very good. Okay, keep them closed. Blowing some more air. Very good. Okay, so let's see. Here, I'm going to take these. Okay, so I have some colors, and you're going to tell me what color you see. What color is that? Good. Now I want you to follow the shape and tell me what shape this is. Square. Okay. next color. And what color is this? Good. Now I want you to follow the shape and tell me what shape this is. Good. Square. And this. A triangle. Very good. And last one. Circle. Very good. All right. Now, last color. What color is this? Very good. It's blue. Okay. Now follow the shape. Let me know what shape this is. Triangle, very good. And this one? A circle, very good. And last shape. A square, very, very good. Alright, since we're doing all different colors, we have another one here for you. Okay, so I have these two light sticks, and I want you to choose a color and follow it, okay? Right. So, what color did you choose? Okay, good. Alright, so I want you just to follow that color, okay? Even when a different color blocks it or tries to distract, just follow your color, okay? Now, I want you to choose the other color, okay? So, follow the other color. Okay. Changing the color now. One moment. Alright, two new colors. Okay. And what colors do you see? Okay, good. So I want you to follow the blue. The blue. Just with your eyes, okay? Good. So follow the blue. Okay, now follow this color. Looks red, but it might be orange for you. Okay. Very good. Okay, now follow the blue again. Just with your eyes, okay? Just with your eyes. Good, good. Very good. Good. Okay, we're all done with the colors. Now we're going to test your color blindness. So, I just want you to tell me what number you see. Okay. What number is this? Good. 12. And what number is this? 8. This number? 29. This number? 5. This number? 3. This number? 15. This one? 74. Okay, it's gonna get a little harder. This number? 6. this number 5, and this number 7. This number 16. This number 73. This number. Okay, there's no number there. And this number. And there's no number there either. Okay. This number 26. And this one 42. And this number. Good. And this number. Very good. All right. You passed with flying colors. All of them were correct. Okay. So this one, I just want to see. So I'm going to turn this on. I want you to tell me when you see the red light, okay? Okay. Good. Good. Very good. Okay. Now I want you to close your eyes. Close your eyes. And I want you to tell me if you can see the light through your eyelids. Can you see it? Okay. Then tell me when the light goes away. Good. Let's do that again. Okay. So when you see the light. Good. Great, it's gone. Okay. Now, tell me which way the light is going. Good. Same thing. Good. Okay, now open your eyes. I want you to tell me again which way the light is going. So left to right or right to left. Ready? Good. Which way? Good. All right, now up or down and up. Good. Good. Very good. Okay. So I'm going to touch your eyes again. Just going to palpate very softly. I just want to see if it feels uncomfortable or you feel any pain, okay? Just close your eyes. Close your eyes. Open your eyes. I'm gonna do kind of the same thing but with this really little hammer, so it's very gentle, it's not gonna hurt, so just stay still and close your eyes, okay? All right. Any pain there? No. Very good. Okay. So, I have this tool here that's going to measure the distance between your pupils. So we're just going to do that. Okay. So stay still and look at my nose. Okay, just my nose. Don't look anywhere else because we have to be super accurate here, okay? Okay. Okay, try to measure it precisely on your pupil. Stay still, stay still. All right, let's see. Okay, this is good. All right, so it stayed the same as last year. So this is pretty helpful for when you go and get glasses. It's very important that you have that number. Okay, very good. And lastly, I'm just going to take your temperature, make sure that you're feeling healthy. Okay. Let's see. All right. Good temperature. All right. So that is it for today. We are able to remove those eyelashes out of your eyes. And we are going to be sending you home with some eye drops just in case your eyes get irritated from removing all of that. But all the tests we did, it seems like you don't have any irritation at all. I don't really see any redness either. But yeah, I think that is it for our exam today. It was very lovely to meet you, and I hope you have a lovely rest of your evening. Okay. All right. I'll see you around. Bye. Oh. Hi, welcome in. Okay, so looks like you should be my next appointment. Is that correct? Okay, so yeah, you're here for an eye exam. Is there anything that we should know before we begin? Oh, okay. Okay, so you have something stuck in your eye. Okay. When did that happen? Okay. Okay, on a scale of 1 to 10, how badly does it hurt? Okay, so not too bad. That's good. Okay. So do you wear contacts or glasses? Okay. And which eye has the object? Oh, both of them. Okay. Do you know what it could be? Okay. Not really sure. Okay, don't worry. We'll look into it. Okay. Now, when was your last eye exam? Okay. Okay, we can begin now that I have all that information put in. And I have this light, and I just want you to look at the light, okay? Just look at it. Does the light hurt at all? Is it too bright? Okay. Now what about this red light? Does the red light hurt at all? Okay. Does that pain in your eye cause your eyes to water at all? Okay, a little bit. Gotcha. Yeah, I do see redness. I do see that. It's also a little bit watery. Okay, so can you follow my light? Okay. Other way. Okay, no, keep following it. Don't move your head. Just your eyes. Just move your eyes. Okay. You're doing great. Okay. Did any of that hurt to do? Okay, good. Alright, now we're going to do the same thing, but with this light here. With this red light. Okay, follow it. Follow the light. Just with your eyes, not with your head. Okay. And then here. Okay. Did that hurt at all? Okay, good. Alright, tell me when you see this light blink. Just like that, okay? Okay, now look at my nose. Just tell me when it blinks. Look at my nose. Okay, good. Very good. We're going to do the same thing with this white light. Okay, my nose again. Tell me when it blinks. My nose. Okay, other side. Okay, can you tell me how many fingers I'm holding up? So just look at the light. Okay. Good. Okay, look at the light. Same thing. Very good. Okay, so I'm not really concerned about how your eyes movement is or your peripheral vision, so that's pretty good. I'm just gonna put gloves on. I'm gonna touch around your eyes. Okay. Okay. Eyes, gonna palpate a little and just see if and just see if you have any irritation. Sorry. All right. Okay, how's that feeling so far? Wait, good. I'm just gonna continue that then. Just want to make sure that you're comfortable. You're not feeling any pain. Okay, I need you to close your eyes now. I'm just gonna palpate your eyes. Okay, so just gonna be a little hit. This is gonna take all the force. All right, just tell me how that makes you feel. If it hurts, uncomfortable. Okay. Very good. Very good. Just gonna touch under really quick. Okay. Okay. I'm gonna take my light again. I'm just gonna look super close. Does the light hurt at all? Okay. I'm gonna just stay still. Try not to blink. I'm just gonna try to see if I can see whatever is in both eyes here. Okay, I definitely see a lot of redness. So I think it could be dust, or it can just be an eyelash. It's nothing too crazy. It just looks like it's been there for a bit and it's caused a lot of irritation that way. Let me look at the other eye. Okay, try not to blink for me. Okay, can you look up? Can you look down? Can you look left? And can you look right? Good. Same here on this eye. Can you look up and down? Now left and right. Very good. Okay, yeah. Did moving your eye like that hurt at all? So I'm gonna take this light here. I'm just gonna look really close at your eyes. Look at my nose and try not to blink, okay? Okay, you can blink. Good. Okay. Now look up for me. Now look down. Now left and right. Good. Okay, same thing. I'm gonna be really close. I'm gonna look at this eye. Try not to blink unless I tell you. Okay. So, okay. Stay still. Okay. Alright, you can blink. Okay, now can you look up? Can you look left? Can you look down? And look right. Good. Okay, can you follow this light? Good. Good. You're doing absolutely fantastic. Okay. I'm gonna close one of your eyes. Same thing, just follow this light here. Great. Okay, so now I just want to clarify that all of this movement didn't cause a lot of pain, did it? Okay, so now we're ready to move on and get rid of whatever's in your eye. So I have this syringe here. I'm just going to put some liquid in here that's going to go in your eye and it's going to flush away whatever you have, okay? Okay. We're gonna start off with this eye here. Okay, so just try to stay still for me and keep your eyes open. Okay, you ready? good. Alright, now we're gonna do the next eye. Okay, stay still. Try not to blink. Ready? Very good. Okay, so I'm gonna just take my light. I'm gonna look and see how things are looking. Alright. So how is that feeling now? Okay, so you feel some relief. That's great. Okay. Already looking at your eyes, you can see that we were able to remove it, and it was definitely from all that. Examining your eyes was 100% eyelash stuck in both eyes. Happens all the time, but it does cause a lot of irritation, so it's a good thing that you came and let us remove it instead of attempting to, because it could really hurt you if you tried. But yeah, I am not seeing anything else. That's great. But we are going to just start with the rest of the ear examination now that we got that removed. Okay, so we're just going to do some color tests now, and I want you to tell me, what color is this? Okay, I'm gonna make a shape and tell me what the shape is, okay? I'm gonna make it with my light. I'll go a little closer. And what shape is this? Good, a square. Next one. What shape is this? A circle. Last shape. Triangle. Very good. Next color. What color is this? Very good. Now time to do some shapes. What shape is this? Good. And the shape? Great. And last, very good. Alright, we have one more color. What color is this? Good. Alright, now follow the shape. What shape is this? Square. Good. And the shape? Triangle. Now this one's going to be one we haven't done before. And what shape is that? Very good. It was a heart. Now we're going to continue with color. We're going to see if you have any color blindness. So all I want you to do is tell me the colors that you see and also the number. Okay. Alright, what colors you see? And what number? Good, 12. And what colors you see? And what number? Good, 5. And what colors you see? And what number? 3. Good. I almost dropped it. Okay, colors you see? And what number? 15. And what colors do you see? And what number? 74. What colors do you see? What number do you see? What colors? And what number? 45. And what colors do you see? What number? Now, what colors do you see? And what number? 7. What colors do you see? And what number? 16. What colors do you see? And what number? 73. What colors do you see? And what number? Very good. There is no number here. And what colors do you see? What number? Good. This one also does not have any numbers. What colors do you see? What number do you see? 26. What colors do you see? And what number? 42. What colors do you see? And what number? Good, there's no number. What colors do you see? And what number? Good, no numbers. Okay. You did a fantastic job. You got all of them right. So I'm not worried about color blindness at all. Okay. Now, I want you to look straight ahead. We're going to put this on your face, okay? And I want you to tell me when you see the sparkling lights. Yeah, just like that. Very good. 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 All right. I want you to tell me when you see the light. Good. 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 Very good. Now we're going to do your other eye. Okay. All right. Now, let me know when you see the sparkling lights. Very good. Now we're going to lift this up. Now, tell me when you see the light. Very good. Now I have 2 light sticks, and I want you to follow the green one, okay? So follow the green. Follow the green. Even when the blue gets in the way, follow the green. Good. Now follow the blue, even when the green gets in the way. Very good. Okay, now tell me the new colors. What colors do you see? Right? Now I want you to pick a color and follow it. Now don't get distracted by the other color. Just follow the one that you chose. Okay? Alright. Now follow the other color. So don't get distracted. Okay? Don't get distracted. Very good. Okay, we're going to change the colors again. Alright, now what colors do you see? Good. Now follow the blue. Follow the blue. Follow the blue. Now follow the orange. Very good. Okay, so lastly, I'm just going to measure your pupils. So we're going to see how far they are apart from each other. So I have this tool here. Okay. So stay still for me. All right, very good. Okay. Good. Okay. So I'm just gonna write down some notes so far about our visit, and then we'll be good to go. Write down that measurement. Okay. So what I'm thinking after removing those eyelashes out of your eye is that we'll bring you home with some eye drops. And those eye drops are definitely going to help with the redness or any irritation that you're feeling. But after a few days, I'd say like 3 days, if that irritation doesn't go away, definitely give us a call back and try to book another appointment, just in case it was something else that we weren't able to see. But I think you'll be good by 3 days. Yeah. But yeah, write that down. Yes, so that is the end of our appointment. I hope your eyes end up feeling better, but they definitely will now that we got rid of those eyelashes. But yeah, it was very lovely to meet you, and I hope you have a lovely rest of your evening. All right, I'll see you around. Alright, we're going to be looking at your eyes today. Okay, so can you look at my nose here? Good. Okay, now look at the light. Good. Good. Look at the other light. Don't look at this light, look at this light, okay? Okay, now look at this light. Okay, this light. Now this one. Now look at this light. And this one. Now look at my nose. Look at my nose. Look at this light. Good. Okay. Now follow this light. Follow it just with your eyes, not your head. Good. Okay. Good. All right. Now I want you to look at my nose. Just look at my nose here. Don't look anywhere else. Just my nose. I want you to tell me when you see the light leave your vision, okay? All right. Starting now. Good. 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 You're doing great. Good. Okay, same thing, but with a bigger light here. Okay. Very good. Okay, so is there anything wrong with your eyes at all? Okay, so you're just here for a checkup. Gotcha. Okay, totally fine. We're gonna just look at your eyes and make sure that everything is okay. All right, so right now I'm just gonna look at your eyes. Just looking at them. You have very pretty eyes. Very pretty. Okay. Does the light hurt at all? No. Okay, how about when I use the bigger light? No? Okay. Close your eyes for me. Okay. Now tell me if you can see the light shine through your eyelids. It's kind of bright. Okay. You do, okay. All right, now tell me when you don't see the light shine through your eyelids anymore, okay? Okay, good. Good. Good, very good. Okay, so just to start off, I wanna make sure that you're not sick. So I have a thermometer here, and we're just going to put them in your ears, okay? Then we're going to just see what your temperature is, okay? So stay still. Just going to put it in your ear here. Good. And then we're going to do this ear here. Perfect temperature, nothing to worry about. Okay. All right, so I'm just going to use this tool here. So I have a different top on it, so I'm gonna change it. I'm just gonna examine your eyes with this. On the light here. All right, just gonna look at your eyes. Okay. Okay. I'm not gonna touch your eyes right now because I'm not wearing gloves, but I will be putting on gloves. Okay. Just seeing how your eyes react to that light. Looking at your pupils. I'm gonna put gloves on because I am gonna look in your eyes and touch your eyes. So just give me one moment, trying to pull this glove out the box. Okay. Alright, so I have both the gloves. Okay. Put that on. So, okay. so hopefully it doesn't rip the gloves. I'm the worst at putting gloves on. Okay, glove number 1 is on. Okay, let's put on this one. Now glove number 2 is on. Okay. Let's just look at me. Okay, you can look at my nose. If the light is too bright, you can't close your eyes, okay? Just blink. Just let me know when you'll blink, okay? Alright, let's go. Okay. Feel any pain with this light or me like touching your eyelids? Okay, good. Yeah. Alright, can you look up for me? Good. Can you look left? Okay. And can you look right? And can you look down? Okay, same thing on this eye. Can you look up for me? And can you look down? Now look left and look right. Very good. Okay. So your motion with your eyes is looking very good. Okay. I want you to look at this light here, and I want you to tell me how many fingers I'm holding up, okay? But look at the light. You have to look at the light. All right, ready? All right. Making little squeaky sounds. Okay, we're going to be doing the same thing now on the other side. Look here. Okay. Now tell me the number. Okay, how many fingers I'm holding up? Keep looking here. Okay, very good. All right. Now I have this here. This is a black stick. There's a ball at the top. I want you to follow the tip, okay? Just follow the tip. Follow it. Follow it. Okay. Closer. It's kind of hard to see because my hair is pretty dark. Background's pretty dark. Okay, but you're doing great. Good. I have these two objects that blow air. So, I want you to look at my nose and try not to blink. I just want to see how you react to this air pressure blowing in your eyes. So, okay, it's not gonna hurt at all. Just stay still for me and stare at my nose. Okay, don't blink, right? Alright, I'm gonna do it in 3, 2, 1. Okay, now we're going to do the other eye. Ready? 3, 2, 1. Okay, we're going to go back, right? And this eye, please stare at my nose. Right, you can blink a bit. Blink, blink, blink. Alright, ready? 3, 2, 1. Good. And now the other eye again. So stare at my nose. Blink, 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 blink. Alright, now stare at me. Stare at the nose. Ready? 3, 2, 1. Good. We're going to be doing the same thing, but this one's a little different. Okay, so look at my nose again. We're gonna start off with this eye again. Okay. So, stare at my nose. Don't blink. In 3, 2, 1. Good. So other eye right here. Same thing. Stare at my nose. You can blink right now. Alright, now stare at my nose. Ready? 3, 2, 1. Good. Okay. Now this eye again. We're going to do it one more time. Okay? Stare at my nose. Stare at my nose. Alright. 3, 2, 1. Alright, now blink, 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 blink. Alright. Now, stare at my nose. 3, 2, 1. Very good. Very good. Alright, so far that looked really good. You reacted like a normal person would, so nothing that's concerning with your eyes. Okay. Alright, we're gonna go and do kind of like the same thing. This time I'm gonna use this hammer and I'm gonna just press this close to your eye. Okay, I'm gonna tap a little bit. So I want you to stay still, and I just want to see how you react to this hammer pressing up against your eye. Okay, so it's very soft, no pain at all, just a little tiny bit of force. Okay, so we're just gonna work on this eye here. All right, just look at my nose again. Okay. Very good. Did great. Let's do the other eye. Okay. Ready? Very good. You did great there. Okay, let's see now. Alright, so I have this tool here, and it's gonna make a beep sound, but it's also gonna show a red light at the very tip of it, okay? So I need you to tell me when you see the red light. Okay? Alright, tell me when you see the red light. Okay? Alright, so that's how the red light looks. So now all you have to do is count how many times you see the red light, okay? Just count how many times. Just count for me, okay? Alright, let's begin. Okay, how many times was that? Great. Okay, how many times was that? Good, that was 5. How many times was that? Good, that was 6. Great. You did very good there. Right. So, I have this that's going to cover your eyes. Okay. And I want you to tell me when you see the light shine through. So, it's going to come out in like very tiny dots. Okay. So, just tell me when you see those lights. Okay, so we're just going to cover your eye. Okay, actually, let's do it this way. Alright, here we go. Good. Right. Do you see any light now? No. Okay, good. How about now? Good. So what does that look like to you? Okay. Do you see a shape at all? Okay. Can you count how many circles you see? All right, good. Very good. You're doing great. Okay. Do you still see some light? Okay. How about now? Do you still see light? Okay. How about now? Do you see light? A little bit. Good. Now let's do the other side. Okay. All right. So let me know when you see the light. Good. Okay. So what does the shape look like now? Does it still look like a star? Okay, it looks upside down. Gotcha. All right. Do you still see light? Good. Okay, can you count how many circles you see? Okay. Let's count how many circles you see. You're doing good. Okay. Now, do you see the light? Good. Okay. Let me just adjust this quickly. Okay. How about now? Do you see the light? Do you see any lights? Do you see any lights? Do you see any light? And now, do you see any light? Very good. Okay, I'm just going to touch your eye quickly. Just going to palpate your eyes, okay? Did that hurt at all? Okay, good. I'm just going to do a little bit more. I'm going to touch. Good. Okay, so no pain at all, right? Great. Okay, so now what I'm going to do is where is it? Okay. So I have a color blindness test for you to take. Okay. So all you gotta do is tell me the number that you see on the page, okay? That's it. Just tell me the number. Alright. Okay. So what number is this? Good. What number is this? Good. And this number. Good. How about this one? That's a 5. And what about this one? A 3. Okay, I'm gonna get a little tricky. What number do you see here? 15. Great. And this one here? 74. Okay. Now the colors are changing here. So what number do you see here? A 6. Good. And here? 45. Do you see any numbers here? Good, or no numbers here? How about here? Good, no numbers. You might think that there's numbers, but no. Okay, we're changing the colors again. So, do you see a number here? What number is it? 26. Good. And this one here? 42. Great. We're all done with that. You did fantastic. Okay. So what we're going to do last is just measure your eyes just to see what we're looking at right now. So we're going to start with this here. So I'm just going to measure the distance between your pupils. I need you to just look at my nose, okay? Look at my nose. Right. Use this light. Just gotta see. Okay. Stay still. Look at my nose. Okay. Line it up with your pupil. Alright, and now we're gonna look here. Line it up. Okay. Okay, this should be it. Okay, so we got 3 and 2. Good. Great. You did good there. Just gonna look. Good. Okay. Now I'm just gonna measure your eyes with a measuring tape. Measurements look good. Okay. Last thing. Okay. So, can you see the light? Okay. See the light? Alright, do you see the light now? Okay, so tell me when you see the light. Okay. Is the light on the left side or on the right side? Okay, how about now? Do you see the light? Do you see the light now? Okay, how about now? Is the light towards the right or the left side? Okay, and here? Left or right side? Good. So your other eye. Okay. Do you see the light? Good. Is it towards the left or the right? Good. Now, do you see the light? Okay. Is it towards the left or the right? Okay. Do you see it on both sides? Good. Okay. Covering one eye here. Can you see the light? Can you see the light? Okay. Okay. You follow the light? Good. Alright. Can you see the light? Can you see the light? Can you follow the light? which light is blinking. Okay, good. So tell me left or right. Okay. Actually, look at my nose. And now tell me which light is blinking. Can you tell me which light is bigger? Okay, do they look kind of the same? Which one's brighter? Good. Now which one's blinking? Okay, tell me when it stops blinking. Good. Right, now which one's blinking? Okay, now tell me when it stops blinking. Good. Right, now tell me which one is blinking. Good. Is there any blinking now? Good. All right. Your eyesight is looking fantastic. I think that is all the tests I have for you today. You did fantastic. Very, very good. Nothing that I'm worried about. Everything is looking the same as last year. Yeah, it was very lovely to meet you, and I hope you have a lovely rest of your evening, okay? Alright, I'll see you around. So you're here because something is stuck in your eye, but don't worry, we'll be able to take it out. So I'm just gonna put my gloves on. Do you know what it is? Okay, so you think it might be an eyelash. All right. Okay, so could be an eyelash, could be some dust, some sand. So when did this object get in your eye? Okay, so pretty recently. All right, so I'm just gonna touch your eyes, okay? So just stay still for me. Let me know if you feel anything that is uncomfortable, any discomfort, any pain, okay? Okay, stay still. Okay, so I do see redness, and it looks like you have something stuck in both eyes. That's kind of interesting. I think it might be like something like dust, because it's very unlikely for an eyelash to get stuck at the same time in both eyes. Okay, so no worries. This is totally easy to get rid of, but okay. So I'm just going to take my light and I'm going to just extend your eye like that. So opening your eyelids. So just stay still, okay? Don't fight it. Right, there you go. Okay. Yeah, you definitely see the irritation there. Okay, let me see the other one. Okay. This one's a little less red than the other one. This one eye right here is a lot worse. Okay. So I want you to look at this light, okay? Tell me, is it like really bright? Does the brightness hurt? Okay, just look at the light. Just look at the light. Okay, now I want you to follow it. Just follow the light. Okay, look at my nose. Look at my nose. Tell me when you see the light blink, okay? Just tell me when you see it, when it blinks. Look at my nose, though. Okay? Alright, so we're going to do the same thing, but I want you to count how many times you see it blink, okay? Okay, look at my nose. Okay, how many times was that? Good. That was 6. Okay, same thing. Look at my nose. Look at my nose. And just count how many times it blinks. Okay, that one didn't count. Ready? Look at my nose. Starting now. Okay, how many times was that? Good. That was 9 times. Okay, I'm just going to look closer. Okay. Alright, can you look left for me? Okay. Okay. Can you look to the right? Okay. And up and down. Okay. Alright. Did you feel any more pain when you moved your eye around like that? Or was it just the same? Okay. Just gonna touch your eyes again. Can you close your eyelids now while I touch? Okay. Alright, open. Alright, same thing here. Can you close your eyes? Alright, you can open. Okay, good. Alright. Before we go in, I'm just going to keep examining your eyes a bit. I have another light here, so just look at my nose. Okay. Alright, and we'll get the other eye. So just keep looking at my nose. Okay. Okay. Can you look over here for me? Look over by my hand. Look here. Okay. Now look over here. Over here, over here. Okay. Good. Okay, so now what I'm gonna do is try to take out whatever is in your eye. So right now I have this tool here and it's just gonna blow some air in your eyes, okay? So just keep your eyes open and if you need to blink, just let me know, okay? So I'm gonna help out by opening your eyelids, but if you need to blink, just let me know, okay? So we're gonna begin. I'm just going to use this tweezer here and I'm going to try to pick some of them out. So stay still. your eye open. Look at my nose. Okay. Other eye. All right, good. So it looks like we were able to get rid of it. So it was 2 eyelashes. I really thought it was going to be dust because both eyes had irritation, but it was 2 eyelashes. But yeah, that's really good. We were able to get rid of it, but you're still going to feel a little bit of irritation. So you just have to wait until it settles down and your eye feels good now that it's removed. Okay. I'm just going to keep looking at your eye though. Just want to make sure that everything is looking healthy and good. So let's open your eye here. Okay, we have the very bright light. Okay, does the light make you feel uncomfortable with how bright it is? Does it hurt at all? Okay, good. How about on this eye? Okay. Okay, so since you're here, we're gonna just do we were doing like an eye exam. We're gonna continue, even though we were able to remove that that was in your eye, but we're gonna continue and just do a couple more tests on you just to make sure, like I said, everything looks very healthy. Okay. Okay, we're gonna start with this and just gonna put this on your face. Okay. All right. So I want you to tell me when you see the sparkly lights. Okay. And then now tell me when you no longer see them. Good. So same thing. Tell me when you see them. Tell me when they go away. Good. Doing great. Very good. Okay. Now we're going to do the same thing. So I'm going to cover one of your eyes. Okay. Let me actually get my other flashlight here. Okay. Covering one of your eyes so you can only see out of one, right? So now I want you to follow this light. Good. Don't move your head, just your eyes. Okay. Now we're going to switch eyes. Okay. Alright, good. Alright, follow my light. Good. You're doing great. Same thing, I'm just gonna look at your eyes with this tool. Okay. Okay. Good. You're doing really good. Just keep looking at the light for me. Right. Now tell me if the light is farther away or closer. Right, this is far. Right. Now it's close. Good. Same thing with your other eye. Okay, this is far. That's close. Good. just gonna take this measuring tool. I'm just gonna measure your eyes, okay? Let me get this one test out. Okay. So I have this test here, and it's a colorblind test. So I want you to tell me the number that you see. Okay? Right. So what number is this? Good. What number is this? Good. What's this number? What's this number? This number? This number? And this one? You're doing very good. Okay, so now the colors are changing. Okay. This one. And this one. This one. This one. This one. This one. Okay. And this one. Good. There should be no numbers here. And this one. Okay. Same thing. No numbers. Changing colors again. Okay. This one. This one. Okay. This one. Good. No numbers again. And this one. Good. No numbers. You did fantastic. You got all of them right. Let me put this back. So I have this tool here. I'm just going to tap around your eyes. Okay, just want to see how you react. Okay, so stay still for me. You're doing great. Very good. Now I want you to follow this tip here. Don't move your head. Just move your eyes, okay? follow the tip. See the tip? Follow the tip just with your eyes, not your head. Sometimes it's a little bit tougher because it's not a bright light. You're doing great. Good. Same thing. Look at my nose. Well, not same thing, but another test. Look at my nose. Okay. And tell me when you no longer see the light in your vision. Good. Good. Fantastic. Okay, now I want you to follow the light. Okay. Follow with your eyes, not your head. Okay. So now I want you to tell me when you see a light shine, okay? So, should be a red light. So let me know when you see it. Good. Good. You're doing great. Do you see it even when it's far away? Good. Great. Okay. And last test. I am going to scan your eyes. So this is a new thing that we're doing. Okay. So I'm just gonna scan your eyes. So just staring at my nose, okay? Okay, stay still. Okay. Good. All right. You did a fantastic job. Everything is looking really, really good. So I'm not concerned at all about your eyes. And I could already see that the redness from the irritation of removing whatever was in your eye is going away. But we are going to be giving you some eye drops to go home with you that you can use for a few days. And if the redness doesn't go away, you can call back and we can check it out again. But yeah, that was the end of the exam, and it was very lovely to meet you, and I hope you have a great rest of your evening, and I'll see you around. Hi, so today you're here for an eye exam because you have something stuck in your eye. Okay, I have a couple questions. So when did this thing get inside your eye? Okay. All right. Does it cause a lot of pain? Okay, just a little bit. Okay. And do you wear contacts or glasses? Okay. All right. Has your vision changed at all because of the thing that's in your eye? Okay. Okay. So I think we can get started now. So I have a light and I'm just going to look at your eyes. Okay. I definitely do see the redness. Yeah. We can definitely help you. I see this all the time. It could be some dust, it could be an eyelash. Okay. Does the light hurt your eyes at all? Okay, that's good. Okay, can you close your eyes for me? I'm gonna use a different light. Tell me if you could see the light through your eyelids. It's very bright. Okay? How about now? No? Okay, good. You can open your eyes. That's good. All right. Yeah, I do see the redness. I'm not too worried about it. Like I said, this happens all the time. But we're definitely gonna look inside. We're gonna get rid of it. I'm gonna put my gloves on because I'm gonna be touching your eyes and just making sure that there's no pain or anything, making sure that it is an eyelash and nothing to worry about. Okay. All right. So I'm just going to touch your eye with my gloves. Just touching your eye. Are you feeling any pain? Okay, I'm just gonna palpate along your eyes, your face around it too. So just like around this area. Okay, and then on your eyes. You can close your eyes here. Okay, good. Alright, but I totally forgot. I'm just gonna make sure that you are all healthy. Gonna do the thermometer, see your temperature. Okay, so just stay still for me. Okay. Alright, let's see. Okay, everything's looking good. Alright, we're just gonna do one more. Okay, and this one goes inside your ear. Just want to be extra careful, make sure that it's not because of an infection that your eye is feeling the way it does. Okay, so I'm just gonna put this in your ear. Okay, and now, oops. And now we're gonna do the other ear. Okay, good. Your temperature looks great. we're gonna go back with the flashlight. Okay. So touching it didn't give any pain. So it might not be something really big. It might be like a tiny eyelash. Can't really tell right now from just looking. Okay, so I'm just gonna. Okay, yeah. Let's see. All that red. It looks like, honestly, both eyes are irritated. So I don't think it's an eyelash. I think it might be some dust. Maybe even some sand. If you've been to the beach recently, you know, sometimes it gets windy and then it goes inside your eye. So, yeah. I think that's what it might be. Yeah, just stay still for me. Let me know if you have to blink. I know I'm holding your eyelids. Okay. 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 I'm gonna check with this, and then I'm gonna try to remove it, okay? So, yeah. Try to take it out right now. So I have 2 tools, and we're just gonna blow some air in your eyes, okay? So just try to stay still for me, okay? Let me try this one now. This one has a little bit of liquid. Okay, stay still. You're doing really good. Okay, now let's do this eye. How is that feeling for you? Okay, so it's not gonna feel the best right away, but it's gonna help, you know, take away that pain that you have later on. Like, it's gonna take some time. Okay, so I'm just going to do an eye exam on you just to make sure that whatever was in your eye didn't impact your vision, okay? And it looks like you're due for an eye exam anyway. So, I want you to look at the light. Okay, can you follow it for me? Just follow the light. Good. Okay. Now I want you to look at my nose. All right, tell me when the light leaves your vision, okay? Okay, so let's look at my nose. Very, very good. Okay, now I want you to look at the light. Okay, tell me how many fingers I'm holding up. Okay, so look at the light. Okay, now ignore the light and just look at my hand. Okay, tell me how many fingers I'm holding up. Ignore the light. Just tell me the fingers. Good. Okay. I'm gonna cover one eye. Okay, just follow the light. Don't move your head, okay? Other eye. Alright, so now I have 3 different colors. And I want you to tell me what color this is. Good, okay. So that was blue. Alright, now tell me what shape I'm making with my light. Good, the circle. Okay, and now a square. Good, and this. Good, a triangle. Now what color is this? Red. Okay, now tell me what shape I'm making with my light. A square. Good. Okay, and now a triangle. And a circle. Very, very good. Okay. Now last color, yellow. Okay. Now tell me what shape I'm making Very good. A circle. Good. Okay. This one's different. What does that look like to you? A star. Okay, and this one's gonna be different too. What shape is this? A heart. Very, very good. Alright, and I have 4 different colors here. Can you tell me what this color is? This color? Good. This color? Good. This color? Good. This color? Great. Alright, so I have this little hammer, and this is gonna test your reflexes, okay? So I'm gonna hit this close to your eye, okay? And I wanna see how your eye reacts to it, okay? Stay still for me. Keep your eyes open. Now I'm gonna switch, and this time I'm gonna lightly hit your eyes. So I want you to close your eyes for me. Okay, so I'm just gonna lightly touch around your eyes, okay? Okay, so I did that eye. Now we're gonna switch eyes. Okay. Very good. So I have another test for you. Okay. So we're just gonna see your colorblind, if you're colorblind, that is. Okay, so what number is this? Good. And this number? Good. This number here? This number? What number is that? Good. This number? A little tough. This number? This number? Okay. Do you see a number here? Do you see a number? number is this? This number. Do you see any numbers? Any numbers? Okay. How about here? Any numbers? What do you see? Good. All right. We are all done with this test. You did a fantastic job. I have a bunch of letters on this screen. Okay. So I want you to read this line for me. Good. Okay, can you read this line? Alright, and what's the color underneath that line? Okay, now I'm just going to put this right here. Can you read the last line? It's the line right here. Sorry. One moment. Can you read the last line for me? Okay, how about the one before it then? Okay, very good. I'm just gonna look at your eyes one more time. I'm gonna touch one more time. Let me know if you feel any pain. Okay. Good. Very good. Okay. So we are done with your eye exam. Looks like the redness is slowly going away, but we are going to be giving you some eye drops to take with you. So if you still feel some pain in your eyes or the redness doesn't go away, please let us know and we'll book another appointment for you. But yeah, your vision looks really, really good. I see no changes at all from the last time you were here. So yeah, we are good to go. But yeah, it was very lovely to meet you, and I hope you have a lovely rest of your evening. Okay, I'll see you around. So today we are going to be doing an ear exam on you. So let me just get my gloves on. I think that's 2 gloves there. Okay, we got 2 gloves, and I'm just gonna put them on. But before we start, is there anything that you should want to let me know about your ears? Have they been bothering you lately? Okay. How about like loss of hearing? Do you have any of that? Okay. Okay. Anyone in your family that has any hearing loss or anything going on with their ears? Okay. Alright, that's good to know. So, like you said, nothing really going on. It's just gonna be a checkup. Okay. Well, what we're gonna start first is with this temperature gun. So I'm just going to put it in both of your ears, and we're gonna see what your temperature is looking like. Okay. So we're going to start off with this ear here. And I'm just going to put it in there. Okay. Good. stay still for me. Okay. Very good. One moment. Okay. Now let's check the other ear. Okay. So just put it in here. Now stay still. Okay. Let's see here. Okay. Temperature is looking fantastic. Nothing that I'm worried about at all, so that's good. Sometimes that translates to like getting an ear infection or something, but it's looking very good. Okay, so what we're gonna start first is I'm just going to do some measurements on your ear. So the last time you were here last year, we didn't get a chance to do that, so we're gonna do that now. So I'm just gonna measure your ears and make sure that everything's looking good. So it's just like an outer exam for you, okay? Okay. I'm just going to touch your ear a little bit. Okay. We're going to do this ear now. Okay, very good. Now we're going to do the distance between both your ears quickly. Okay. Alright. Good. And then underneath. Okay. And then right here. And here. Okay, very good. Great. Now, I have one more here. So this one's a little bit different, but we just always have to be accurate when it comes to measuring. So I have another one of these measuring tapes. So just going to, this one will be a little bit quicker. Great, very good. Yeah, they look good. So right now, what we're gonna do is just going to touch your ear and examine like the outer, making sure you're not feeling any pain when I touch you. Okay, so yeah, just gonna touch your ears and just see what's going on there, okay? Right, actually we're gonna start off with this ear. So just let me know if you feel anything that's uncomfortable, anything painful, anything that you don't think is normal, okay? Great. things are looking good. So, right, like nothing hurt or felt uncomfortable. Okay, good. Let's see here. I have my light. I'm going to use this light and I'm just going to look at the ears, okay? Okay, just the outer of the ear right now. Okay. Good. Here. Good. I don't see anything that's concerning at all. So now what I'm gonna do is do like a little bit of a hearing test before we look into your ears, okay? So I'm just gonna cover your ears and whisper some words, and I need you to repeat them, okay? Alright. Just gonna do it now. So you did a good job. You said every single word. So now what I'm going to do is use this otoscope, and I'm going to go in your ears, and we're just going to look inside and see if there's anything going on, if there's buildup, if there's wax, redness, irritation, any of that, okay? Great. So I'm just going to move you like this. Okay. Here you go. Now, let's start. Good. Let's move you like this. Alright, now let's do this side. Okay. Okay, good. This side looks good. Let's move this back. Okay. So both ears, they kind of had like a bit of buildup in both, so we're definitely gonna have to do some cleaning there, but it's not a big deal at all. Super easy to do. It's not a lot either, so it's not gonna be too intrusive. It's not gonna feel like any pain or uncomfortableness. So we can begin with this ear. So let me move you back. So all we're gonna do is remove this tweezer, or remove the wax with this tweezer. Okay, so let's start with this ear. Okay, so if you feel any pain or if you're uncomfortable at all, let me know. Okay, good. All right. Let me just look inside, see what's going on. Great. Yeah, this ear is looking fantastic. All right, now let's do the other ear. So let's do this one here. Okay. So that other one looked really, really good after getting the wax out. So let's start now with these tweezers. Okay. Just gonna I'm just gonna look with the otoscope, just gonna look inside. right, that side looks really, really good as well. We were able to take out all that wax. So let's move you back. Wait, but before we do that, actually, we do have to blow away some wax that got stuck on the outer ear. So we're just gonna do that, okay? So we have this little tool that blows away the like the wax, and then we have this as well. So we're gonna start with this one. Okay, now let's do the other tool. Let's do that on the other side. So move you around. There you go. Okay. So I guess we'll start with this one. Okay, now let's use this blue one. Matches my gloves. I think we're good. Yeah. Everything's looking good. Okay. So I'm gonna touch your ears. I'm just gonna make sure that you're not feeling any pain from that removing. So any pain at all? Okay, good. All right, let's see what is next. So now we have to do some hearing tests to make sure that this helped your hearing and not made it worse, if that makes sense. So I have a tuning fork. Okay. So I want you to close your eyes and tell me what side you hear the tuning fork, okay? Good. All right, starting now. Very good. Alright, very good. Now I want you to tell me when you hear the sound stop. So keep your eyes closed for me. that sounds really good. So now what I'm gonna do is my hands are gonna make the sound. And I want you to tell me when you hear that, or what side you hear that sound, okay? Alright. Okay, starting now. That was both. Good job. Very good. Now I want you to count how many times you hear that sound, regardless of what side it's on, okay? Good, okay? How many times was that? Good, that was 5. Okay. How many times was that? That was 7. I actually lost count, so I think you'll be right regardless. Okay. So keep your eyes closed. We're going to do a beep test. So tell me what side you hear the beep. Okay, very, very good. Okay, and another one. So this one's going to be a different sound. So it sounds like that. So I want you to tell me on what side you hear that sound. Okay, very, very good. Okay, keep your eyes closed. Now you're going to count how many times you hear the sound, okay? Starting now. Okay, how many times was that? Good, that was 6. Oh wait, sorry. Let's start again. Starting now. Okay, so that one was a little bit longer. How many times did you hear this sound? Good. That was 13. Okay, we're gonna do it one more time. Just a little faster this time. How many times was that? Good. That was 20. Very, very good. Okay. So you can open your eyes. All right. So that was very, very good. We were, like I said, able to remove some wax. We did an ear exam on you, measured your ears. We did a hearing test on you as well, and everything looked really, really good. We're going to send you home with some eardrops just because we did remove some wax and we don't want there to be any irritation there. So we're going to send you some eardrops, and you're just in both ears once a day for about a week, okay? But your ears look fantastic. Nothing to worry about at all. But yeah, it was very lovely to meet you, and I hope you have a lovely rest of your evening. I'll see you around. Bye. Hi, welcome in. We are going to be examining your ears today, so I'm just going to put on some gloves, and then we can get started. But let me ask you some questions. Is this just a yearly checkup? Okay. Have you been sick in the last week? Okay. Any hearing loss, hearing pain, or pain in your ears? Okay. Alright, so just a checkup. Alright, so I have my gloves on. I'm just going to touch your ears with my gloves, okay? So stay still for me. Let me know if you feel any pain, okay? Any pain there? Any pain? No. Good. Okay, I'm just gonna take my light and I'm just gonna look at the outer of your ear. So I'll start with this ear here. Just stay still, okay? So you said that you haven't been sick, but we are still going to get your temperature. Okay, so stay still for me. I'm just going to do it on your forehead and on both of your ears, okay? A good temperature, but now we're gonna do it with this here, okay? All right, this goes in your ear, so stay still for me. We're gonna do this one here first. temperature, so not worried about like any flu or any infection, so that's really, really good. Okay, so first we're going to start off actually with a little hearing test. So before we start anything, just in case we need to do a cleaning on you, if you do have a lot of wax, just to see a difference between if your hearing is better or if it started off worse in the beginning of the exam, just to see that. So we're going to start with this tuning fork. Okay, so I need you to close your eyes. You're going to tell me on what side you hear the tuning fork. Okay, so like I said, close your eyes. What side did you hear that? Good. 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 Okay, so tell me if this is closer or farther away. Close. That was far. That was far. And that was close. Good. Now tell me when you hear the tuning fork stop. Okay. Good. Good. Good job. Alright, we're done with the tuning fork, but I need you to keep your eyes closed, okay? So I'm going to be making that sound next to your ears, and I want you to tell me on what side you hear it. Okay. Good. Good. Alright, that was both. Now I want you to tell me when the sound stops. Good. 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 Okay, now tell me if this is closer or farther away. Close. Far. Close. Far. Very good. Okay, let me see here. Okay, so I think we're good right now for the hearing test. I have an otoscope, and this is a tool that goes inside your ear so I can look inside, but I need you to stay super still. Okay, we're gonna look inside, so if you feel any discomfort, please let me know. Okay, so stay still for me. We're gonna start this ear here. Okay. Alright, so we're gonna be putting the otoscope in your ear right now. good. Let's go on the other side. So looking at both ears, it looks like you have a little bit of wax in both of them, and I think we should take it out just so you can have better improvement in your hearing. Okay, so super chill. Don't worry about it. It's not gonna hurt or anything. Okay. So first off, I'm gonna start with a fan. We're just gonna brush off the wax that is like on your outer ear. Okay, so stay still. I'm just gonna start with this ear first. Great. Okay. Alright, let me just take a look on the outer. I'm not seeing that much wax on this side. Okay. Okay, so I'm just going to touch your ears quickly before we go in. Just want to make sure it's not too sensitive, okay? Alright, I just want to double check, so no pain, right? Okay, good. Let's see here. Right, I have this tweezer here, okay? I'm just going to be in there, just taking bits and pieces of the wax, right? So just stay still. If you feel discomfort, like I said before, just let me know and I'll stop right away. Okay. Alright, so you can just relax right now, and like I said, just try to stay still, and I'm just gonna remove this wax. Okay. Let's start off with this ear here. Alright, so I'm coming right here. Okay, so stay still for me. other ear. Okay. Stay still for me and let me know if you feel any pain. Okay, we were able to take out a lot of the wax, but like you should know, though, wax is normal, so it's super natural and it's supposed to protect your ears. So I only took out a amount that was needed, so it wasn't like totally removed. Okay, so now I have this here, and I'm just going to blow the wax that was left out of your ear. Okay, so we're actually going to start with this ear now. All right, so this is just going to feel like a little bit of air blowing in your ear. Okay. Do the other one. Great, very good job. Okay, so now I'm just gonna test like the sensitivity of your ear right now. Make sure we didn't do anything that would have hurt your ear. So I have this here, okay, and it's just gonna go in your ear, and it's just going to just put some pressure inside your ear. So if you feel any pain, let me know, okay? Right, check your other ear. since you had no pain, not worried, but now we are going to be checking your hearing to make sure that this cleaning improved your hearing and didn't make it worse. Okay. Alright, so this is a test that we didn't do before. So just stay still for me. Okay. And I want you to close your eyes and tell me what side you hear the beep. Okay. So you can tell me either left or right. Side. Okay, good. Alright, so just like that, that's what it's gonna sound like. Just tell me what side. Alright, good. Now we're going to go back with the tuning fork so you can keep your eyes closed. Alright, so tell me what side you hear this sound, okay? The tuning fork sound. Good. Now tell me when it stops. Very good. We are now done with the tuning fork. Okay. And now we're going to do this sound again. Alright, so tell me on what side you hear the sound. Good. Now tell me if it's closer or farther away. That was close. That was far. Far. Close. Okay, now tell me when the sound stops. I'm going to do another type of test that makes sure that you're not feeling any discomfort or any pain. So I have this little hammer here. I'm just going to tap on your ear. So if you feel any pain, let me know, okay? But I'm going to be very gentle. feel any pain? Good. Alright, let's do this ear. Any pain? Great. Okay, so last but not least, I'm just going to, actually, I'm gonna measure your ears. So this is something we should have done in the beginning, just to see if things are looking the same as they were the last time you were here, okay? Stay still. We're going to end it by using the otoscope again. So we're just going to make sure that everything is looking really good there. No irritation from the ear cleaning. Okay. Alright, so stay still, and I'm going to do this ear first. Good. Now we're going to do the other ear. Alright, very, very good. Okay, so we are done with our ear exam today. Let's touch one more time. Good job today. Your ears are looking fantastic. Nothing to worry about. And we were able to clean your ears when you had no irritation. But we are going to be giving you some ear drops just in case you do get a little bit of irritation just from the cleaning. Okay. But you did absolutely fantastic. And your ears are looking very, very healthy. But yeah, it was very lovely to meet you, and I hope you have a great rest of your evening. Alright, I'll see you around. Hello, welcome in. Could I get your first name and last name? Could you spell your last name for me? Okay. Alright, so looking here, it says that you're here for the detailed ear exam and hearing test. Okay. Is there any reason for that, or is it just a yearly checkup? Okay. All right. Have you lost any hearing recently? Okay. Any pain in your ears? Okay. Ear infections? All right. Okay. So we can go ahead and start. So I'm just gonna put my gloves on. Yeah, so I'm gonna be touching your ear. So you need to be healthy using these gloves. Okay. First off, I'm just gonna start by using my lights. I have a big one and a little one, so I'm just gonna examine your ears. Just gonna look at them, see if I see any redness, anything that looks abnormal. Okay. So far, so good. Okay, I'm gonna use a different light now. Okay. Just gonna touch as well. So I don't see anything concerning, but let me know if you are feeling any pain, anything that's uncomfortable. So they are looking good from the outside. Didn't feel any bumps, any lumps, and you said that you weren't feeling any pain, right? Okay, so let me just write that down quickly. Just make sure that we have these details down. Okay, so no pain, no lumps. Great. Okay. So I have this otoscope here, and this tool goes into your ear very gently, okay? And I'm just gonna look inside, see how everything is looking, okay? So I'm gonna start off with this ear over here, okay? So stay still for me. So it's looking good so far. Just gonna go a little deeper. Great job staying still. That ear looks good. Okay, so we're gonna look at the other. Alright, stay still for me. It's gonna look inside your ear. Okay, just gonna go a little bit deeper. Alright, great job staying still like the other ear. I did see some redness actually in that last ear. Have you been sick recently? I think we asked that question before, but I'm just gonna take your temperature and make sure that you are sick, and maybe an ear infection might be coming pretty soon. So we're just gonna make sure your temperature is good, okay? All right, so stay still for me. Okay. All right, now we're gonna do it on this side. Okay. And this side. Okay, your temperature's good. I have another one here. Okay, and this one goes inside your ear. So stay still for me. Just gonna put it in this ear here. Okay. All right, now let me do your other ear. Okay, good. Your temperature's good, but I am a bit concerned over the redness. So yeah, we're just gonna still continue with the test and make sure that that's not causing any hearing loss or anything. So it's a good thing that we're doing this ear exam today. Okay, so let's see. What we're gonna do now is the hearing test. Okay, so we're just gonna start off with some sounds. Okay, so I'm gonna make this sound on both sides of your ears. So I want you to tell me what side you hear it on, either left or right, or if you hear it on both, okay? So I need you to close your eyes for me. Okay, good. All right, so just let me know what side you hear this sound, okay? Great, that was both. Okay, good. All right, now I'm just gonna touch along your ear, okay? Keep your eyes closed. Tell me what ear I'm touching, okay? Good. very interesting. I'm just gonna write down some notes. Okay. Okay. I have a tuning fork. And I want you to tell me what side you hear the tuning fork. Okay. So you can close your eyes again. All right. Good. Okay, so can you tell me when the tuning fork stops? Okay, so when you no longer hear the tuning fork. Great. Okay. So far, I see no changes with your hearing. Okay, so, or no problems with your hearing. So I have some headphones, and what we're gonna do now is put the headphones on, and they are gonna be making some sounds, and I need you to tell me what side you hear the beeps. It's kind of like that kind of test, okay? So I'm gonna put these on you. Alright, how do they feel when they on correctly? Okay, so let's see here if this works. I'm just gonna play it. Okay. Okay, so it should work now. Let's put these headphones on. Alright, let's start the test. Okay. Alright, so tell me if you hear these sounds, okay? Okay, so it should be calibrating. Alright, here's the hearing test. Okay, just let me know if you hear it, okay? Okay, so for this one, tell me what ear you hear the sound, okay? you did a fantastic job. Okay, so it seems like your hearing is still very, very good. So that's fantastic to hear. So I'm just going to test the outer of your ear. So I have these fans, and I want you to tell me if you can feel this here. Okay. Okay, good. That's really good. Okay, I'm gonna blow some air in your ear. Tell me if it makes you feel uncomfortable, if you feel any pain. Let me know if you could hear this sound. Can you hear that? How about the other side? Same thing. Do you hear that sound? Okay. This side. To measure your ears now. Okay, stay still for me. Write that down and look at your old file. Okay. Alright, so looking at file from the last time you were here. Measurements have stayed the same. Your hearing test stayed the same. Okay, so no worries about that. Good. Okay, let's see what's next. Okay, I'm just gonna look inside your ear one more time with the otoscope. I want to check out that redness again and see if there's any redness on the other side, okay? Alright, so stay still. Good. Okay, so I did see a teeny bit of redness there. Let me see here. Okay. Okay. So I'm seeing a lot of redness here. Yeah. So I'm just gonna I'm gonna use this tweezer and I'm just gonna touch inside your ear. Let me know if you feel any pain. I'm gonna be super gentle, but I just wanna see if that redness is irritation or maybe it's just an ear infection coming in. But yeah, I'm just gonna lightly just tap your ear inside where the redness is, okay? Alright, so no pain, right? Good. Okay, let me do this other side. So I think we might have caught you getting sick. It might be an ear infection coming. Yeah, so I see that the redness isn't hurting you, so that's really, really good. You still have your hearing. I don't see any difference from last year to now, so I'm not too worried about your ear. No. I just think you're getting sick, okay? So just does touching your ear hurt at all? Okay, and on this side. on with your examination. We're just gonna give you some ear drops to go home that you can take. And if your hearing gets worse or if you start feeling pain in your ears, let us know. We can make another appointment for you. But yeah, everything's looking good except the redness. Everything looks fine. So nothing to worry about at all. But yeah, it was very lovely to meet you, and I hope you have a lovely rest of your evening.